Good afternoon, everyone. Thank you so much for joining us. Today, we're looking forward to the Jamaica Midlife Health Society's first CME accredited Zoom webinar symposium for 2026. I hand you over now to our moderator for the first session, Mrs. Magdalena Cooper de News.
Thank you, Sam of Oldgate. And thanks to everyone who is online now. Good Sunday afternoon to everyone. I see there are over 167, 68 and counting persons online. We're expecting many more. And we hope that you have sent your invitation or the message that you got to all of your friends and family. I am now going to introduce our president, who is going to take us through, get us started with the opening remarks and follow through with opening prayer, welcome and greetings from Dr. William Brown, our president again, and then the message from Dr. Honorable Christopher Tufton. And it's now time for Dr. William Brown to get us started with opening remarks. Thank you.
Thank you very much, Magdalena. Ladies and gentlemen, good afternoon. In my opening remarks, I find myself speaking 3 sessions, and at the beginning, I wanted to put the opening remarks, the welcome. But anyway, as opening remarks, I would say something about the JMS. Founded over 25 years ago, our organization has remained committed to promoting healthy aging through public education and professional medical training. As an affiliate of the Medical Association of Jamaica, we take pride in fostering meaningful dialogue and sharing knowledge that supports both healthcare professionals and members of the wider community. Our webinar meetings continue to be very successful and with our mixed audience of medical and non-medical attendees. So today, the JMHS is hosting its first CME accredited Zoom webinar symposium for 2026, entitled The Challenges of Managing Sleep, Stress, and Burnout. Where are you and where am I? Magdalena, over to you for prayers.
Okay, let us pray. Is Mr. Alton Lawrence online or he's not? No? Mr. Lawrence, are you online? Okay, let us pray. Father in heaven, thank you so much for another year and another time when we can get together to be able to communicate and share on the whole principles of sleep, which is so important for each of us. Be with all of the presenters. Help that as they present, that each one of us online at this time and those who will be joining us shortly will find something in there to help us to have better sleep so we can be better citizens in our homes, in our communities, and wherever we are in our global village. Thank you for hearing us. Thank you for loving us. Thank you for this opportunity again, for Christ's sake. Amen.
Amen.
Okay, next we have on the program, back to you, Dr. William, to give welcome and greetings.
Yes. So, ladies and gentlemen, once again, good afternoon. On behalf of the Jamaica Midlife Health Society, it is my distinct pleasure to welcome you all to today's webinar, which will look at the challenges of managing sleep, stress, and burnout. Where are you? This symposium will explore the growing prevalence of sleep disruption, burnout, and stress among adults before midlife, during the midlife, and beyond. It will highlight practical, evidence-based strategies to improve energy so as to enhance personal, community, and national productivity and development. I'm especially pleased to see such a diverse audience joining us today. Medical practitioners, caregivers, and individuals who simply have an interest in aging well. Your presence reflects the growing importance of this conversation and the shared responsibility we all have in improving quality of life across the lifespan. Our webinars continue to be a vital platform for learning and engagement, and today's session promises to be no exception. We have assembled knowledgeable presenters who will provide valuable insights, practical guidance, and thought-provoking perspectives. I encourage you all to participate actively, ask questions, and take full advantage of the expertise being shared. Together, we can continue to build awareness, strengthen our practices, and support healthier aging in our communities. Ladies and gentlemen, thank you again for joining us, and I wish you all a very informative and engaging session. Welcome.
Thank you, Dr. Brown. Thank you so much for that welcome. Can somebody please put in gear, I don't know if that is Sam, the pre-recorded message from the Honorable Dr. Christopher Tufton, Minister of Health and Wellness, please.
Good afternoon. Good afternoon again, Magdalena. Can
I say something, please? I think
go ahead.
There's a message from Dr. Henry Christopher Tufton, who was not able to make it. I was asked to read his message, so I'm going to make it quickly. And
thank you.
I start by saying, quote him, I take pleasure in bringing warm greetings to the leadership, members, and partners of the JMHS. It is both an honor and a pleasure to join you as you open this first webinar symposium. I commend the JMHS for more than 25 years of dedicated service advancing midlife health, education, advocacy, and awareness in Jamaica. Now, your work has helped shape national conversations on well-being at a critical stage of life, and today's theme could not be more timely. The topic, the challenges of managing sleep and stress and burnout, where are you, is a question that invites both personal reflection and public health action. International research reminds us that sleep disorders are not just marginal issues. They are not soft issues. Studies suggest that approximately 2 billion people worldwide snore, and about 1/4 of the adult population classified as regular snorers, and nearly half snoring occasionally. Men in particular are more affected, a pattern closely linked to sleep apnea, a condition that is not only disruptive, but potentially life-threatening. Importantly, sleep disorders are now recognized globally as a significant public health concern. Persistent and loud snoring is often a warning sign of disrupted sleep and underlying conditions such as obstructive sleep apnea. Now, when left untreated, research from leading institutions, including Harvard Medical School and the Mayo Clinic, links sleep apnea to chronic fatigue, impaired concentration, mood changes, and heightened risk of cardiovascular diseases and stroke. Beyond these long-term consequences, poor sleep affects the basics of everyday life. That is our alertness, our productivity, our emotional balance, and even our safety. While there may be no formal government policy specifically addressing snoring, sleep-related conditions are recognized and managed within both the public and the private health systems. Yet, sleep often remains underrepresented in public wellness discussions. We speak openly about nutrition, exercise, and mental health, and rightly so, but sleep underpins them all. Without adequate restorative sleep, the benefits of healthy eating, physical activity, and stress management are significantly diminished. This is why forums such as this symposium are so important. They challenge us not only to increase awareness, but also to shift perceptions. They demand that we see sleep as a foundation of health, not a luxury or an afterthought. As we engage today, I encourage each of us, health professionals, advocates, and individuals alike to ask honestly, where are you when it comes to sleep and stress? And just as importantly, what changes are within reach? Again, I extend thanks to the Jamaica Midlife Health Society for continuing to lead these conversations with vision and commitment. I wish you a successful and impactful symposium. Thank you. Signed, Dr. the Honorable Christopher Tufton, CDMP, Minister of Health and Wellness. Thank you all.
Thank you. That message certainly gives us something to do, which is to really listen more to the presentations and to learn more about sleep, because sleep is affecting a whole lot of us. And we sometimes don't want to say that it's affecting us. So at this time, Olgate, Sam, I don't know if you're the one who will be doing the
Pre-test,
overview of.
yes. So the pre-test is now live in the chat, ladies and gentlemen. It is one of the
Sorry.
requirements for those seeking credits. So please go ahead and complete the pre-test. There'll be a post-test that will be shared later as well. While they're doing that in the background, Magdalene, I believe we can move on with the agenda.
Okay, can you do the video presentation of the overview of JMHS as well, please?
Absolutely.
Thank you. Thank you, Sam from Allgate Solutions. Next, we will have our presenters, our sponsors highlights from Indus and from Abbott. Thank you, Sam.
Good morning. Is it Indus first?
Yes, Indus is first.
Yeah, thank you.
Yes,
So
you're
let me-
welcome.
Yeah, thank you very much. Let me share my screen. Greetings to all. So happy to note that JMH is 29 years. That's a great number of
Yes,
years, more than a quarter
yes.
century. And greetings to all for those. Just to hope you are able to see the screen. JMS has
Yes,
covered 29
clearly.
years, and
Yes.
Indus Life Sciences, I'm pretty sure everybody is aware of Indus. Basically, Indus stands for I and us. We together, that is Indus. So, of course, we have completed 10 years. So, JMS is really inspiring for us. So, we are present currently in all the Caribbean countries, especially from Jamaica, we started with, and then Bahamas, Cayman, Guyana, Barbados, St. Lucia, St. Vincent, Turks and Caicos, and we also now present in Belize from 2026. So I take this opportunity to just refresh some of our brands, which is available across all Caribbean countries. These brands, which I'm going to just refresh today, are our over-the-counter products. So which can be, you can even get it from without prescriptions. That's what it is. One is our antihistamine. Of course, in this one strength is over the counter, whereas other one is a prescription one. We are in a situation where still a lot of flu is going around in the island. We have one of the pretty good antihistamine, which is referred as a second generation antihistamine, which is a fexofenadine, is active drug. The brand name is Fexil. We have it in two strength, 120 milligram and 180 milligram. The 120 milligram is over the counter strength, and 180 is on prescription. The basic difference is that 120 is for mild allergic conditions, rhinorrhea, like running nose, or those conditions, and 180 is for little severe conditions like skin allergic conditions like that. So this is one of the most affordable antihistamine currently in Jamaica. Just to give an idea, the 120 per pill is around $65 per tablet. It's truly once a day, non-sedative. The 180 is around $90 per pill. It's once a day basically. That's our Fexil or fexofenadine. And we have this pain gel. I'm pretty sure all of you must be aware of this. This is a very unique combination of three active drugs, rather four active drugs. One is the capsaicin, which is extracted from the cayenne pepper that we eat. So it's found to be good to inhibit pain by inhibiting the pain triggering factor, which is substance P. When substance P is triggered, we perceive pain. And capsaicin inhibits that, thereby pain is depleted. Diclofenac also depletes pain by inhibiting the triggering factor prostaglandin. And the levomenthol, what you see in the screen, is basically it helps the active drugs to penetrate deep into the tissues. It's a muscle relaxant. Methyl salicylate also found to be effective to deplete pain by inhibiting mediators like IL-1, IL-2, IL-6, which are responsible for triggering pain. So Capsutop is basically for moderate to severe pain. And please remember, this is a gel and this is over the counter. In Jamaica, it is listed as list 2 over the counter, which means the patient can go to the pharmacy and the pharmacy can dispense it to the patient. So that's what it means. So you have to reach to the pharmacist basically, and pharmacists can recommend Capsutop to you. What are the indications? As just discussed, this is a combination. The indication is basically for all this: back pain, neck pain, joint pain, shoulder pain, knee pain, all pain, basically frozen shoulder, and arthritis pain, rheumatoid arthritis, osteoarthritis pain, all this can be recommended. This is a gel, please remember. And we have a spray. This is called as red heat spray. You can look at the composition. This is organic pain spray. When I say organic, as you know pretty well, there is no chemicals on it. Extract from plants. Eucalyptus, turpentine, methyl salicylate, menthol is a composition. So it's very safe. And we know the benefit of a spray. Spray onset of action is very fast. When you just spray it on the area of pain, the action kicks within minutes. Less than 5 minutes, the action kicks in. So you can perceive the reduction of pain within minutes. So, and it's very convenient. We have it in two forms, two containers. One is a 43 ml container, very small one, which can even go in your, your travel kit or in your first aid kit, you can hold it. And we have a bigger version, which is 150 ml, mils, 150 mils, that is also available. And this is list 1 OTC. That means it is available in the pharmacies or even supermarkets or gas stations. You can see them, and there's no need for prescription. You can just pick it up, like where you see water or vitamin pills or something like that. You can see this ready spray. That's our pain spray, and we have the nice tagline which we have for that, the slogan or tagline, whatever you call it as. We have the tagline which says powerful like a real beer, safe like a teddy bear, because of organic. There's no chemicals on it. It's safe like a teddy bear. And for acidity, gas problem, acid reflux, heartburn, we have a lot of antacids in the pharmacies today. When you step in, sometimes you are confused which one could be the better antacid. I could definitely confidently say the one which we are going to see now is the best of the antacid, as because this is referred as the latest generation antacid. That is a new gel. It has a unique ingredient on it, which you will not see in any other antacid. I'm not bashing other brands basically. I'm just highlighting how it is superior. New gel is way superior because this is the first antacid offers you the alginic acid, which is very interestingly found to stop acid reflux, which is basically an algae. Alginic acid, even though it says it's an acid, it's not an acid, it's an algae basically, and it's found to stop acid reflux. So persons who have the episodes of throwing up, or people sometimes eat belly full and then they suffer from throwing up from the stomach, which we medically call as GERD. So it stops it. And this is how it stops. That's what you could see in the screen. When the person takes the new gel, the alginate raft is formed, as you could see in the screen. The white portion that is above the stomach content, that is a raft formed by the alginic acid in new gel, and this blocks the stomach content moving from stomach into the food pipe, thereby no episodes of throwing up. And this is the actual composition. It has dimethicone, you will see in the screen. Dimethicone is to relieve gas. The other ingredients is to neutralize acidity. And who all can take it? Literally anybody can take it, because it's safe in pregnancy, so safe in children too, less than 12 years I mean, and safe all age group basically, and safe in diabetes because it is sugar free. So, and this is list 1 over the counter. That means just like my Reddit description, it is available in gas station, pharmacies, supermarkets. You may see this and you can pick it up without prescription. And we have an extension of new gel, which we call as new gel O basically. This is called as, one-stop solution, or, this is a game changer antacid because it has a unique medication, oxytocin. You don't have to worry too much about oxytocin. It relieves the pain. That's the benefit of oxytocin. So, but this one is listed to OTC. Unlike new gel, this one is listed to. That means you have to reach out to the pharmacist, and pharmacist can give it. Why? Because this is not recommended in pregnancy. That's the reason. So pharmacy can check whether if it's a female person, patient, they'll ask, are you pregnant or so. That's the reason it's classified as listed to OTC. You can get without prescription, but only from the pharmacies. And we have another product. We have it in sachets also, that you could see here. On the go liquid sachets are also available. And last product I just want to conclude is our supplement. That's our, because today we are going to sleep issues, all those things. We have wonderful supplement that can help you, because one of the ingredient in this is tryptophan. I just request you to remember that tryptophan, it called as a stress buster amino acid. When stress builds up, we lose our sleep. So when stress is reduced, automatically we are relaxed and we can have a good sleep. So tryptophan, what you could see in the screen, is a stress buster amino acid, reduces the stress also. Plus it has all vitamins, B1, B2, B6. Plus you could see the amino acids, which is marked in red. These are protein. These amino acids helps for immediate protein synthesis. That is the benefit. And it has zinc, which is good for immunity also. So this is the best of a supplement in terms we call as a comprehensive formula. When you talk about supplement, the best comprehensive formula is amino-pep. And it's good for any age group. 2 years and above is ideal. Less than 2 years, mother's milk is best. 10 ml for adults, 5 ml for kids is sufficient at bedtime. And you can see how good it is in comparison many other brands that is in the market. AminoPep stands tall like a giraffe, offers you more for the value what you pay. That's our AminoPep. It's a chocolate caramel flavor, and it's sweet but no natural sugar in it. So this is also a list to OTC. It is available in the pharmacies. Pharmacies can give it to you without prescription. So AminoPep means gives a pep to your step. That is AminoPep. Thank you very much, and please enjoy the rest of the presentation.
Thank you. I don't know if I can say this, but I will say it in that I have red heat and I use it quite often. It's really good. So thanks again for your
Thank you very much.
presentation on the products.
Thank you.
Yes. All right. So our next presenter and is from Abbott Nutritionals. Over to you, Abbott Nutritionals.
Thank you very much. Just putting up my screen.
Good to see you, Mr. Russell.
Hi. Yes, good to be here. I'm grateful for the opportunity to present to the JMHS community. Are
Thank
you
you.
seeing my Abbott A?
Yes, we're seeing it loud and clear.
Okay. Good afternoon. My name is Paul Russell, and I'm part of the Abbott Nutrition team. And at Abbott, we provide products to help you live your life to the fullest. Now, Abbott's products cover various stages of life, from infants through toddlers, young adults, the aging population, and those with special health needs. But before we look at some of our products, we just need to assess whether your patients are getting adequate amounts of protein per day. Studies are now suggesting that we're not getting enough protein, and approximately 42% of adults aged 51 years and above don't consume enough protein in their daily diets. So we can get quality proteins from animal sources like eggs, milk, meat, poultry, or fish, but some persons are opting for plant-based protein sources, and in that instance, they may be lacking 1 or 2 amino acids. So here's where we need to fill the protein gaps with oral nutritional supplements like Ensure or Glucerna. So first, let's look at Ensure Original. This product provides complete balanced nutrition and key nutrients to support brain health, in that it has vitamin B12 and folate. For your bones, vitamin D and calcium. For your muscles, it has protein, quality protein. And for your immune support, you're having zinc and antioxidants. For patients who are underweight or losing weight without trying, there's Ensure Complete. Ensure Complete provides 30 grams of protein, 350 calories, 25 vitamins and minerals, and 4 grams of fiber, and it's clinically proven to help gain or maintain weight. For patients who wish to maintain a healthy weight or are pursuing intentional weight loss, there's Ensure Max Protein Shake, also having 30 grams of protein, 150 calories, 4 grams of fiber, only 1 gram of sugar, and 25 vitamins and minerals. So to help your patients reach their nutritional goals, we need to direct them to the ideal Ensure. So I want to find the ideal Ensure to help your patients reach their nutritional goals. For your patients living with diabetes, there's Glucerna with Carb Steady to help manage blood sugar response. Now, Glucerna Original has 10 grams of protein, 180 calories, 4 grams of fiber, and it's 1 carb choice. For increased protein, there are Glucerna Protein Smart and Glucerna Hunger Smart. Glucerna Protein Smart has 30 grams of protein, has 150 calories, 4 grams of fiber, 25 vitamins and minerals. For Glucerna Hunger Smart, it has 15 grams of protein, 180 calories, 46 grams of fiber, and that's dependent on the flavor, and 25 vitamins and minerals. So all our Ensures and Glucernas are suitable for lactose intolerance and for gluten-free. Now, we speak of Glucerna being carb steady, which means that it has a blend of complex carbohydrates, which are slowly released into the small intestine, which helps to minimize the blood glucose response. For your patients with hard-to-heal wounds, which keeps them from living their best lives, there's Juven. The wounds may be pressure injuries, diabetic foot wounds, surgical incisions, or other acute and chronic wounds. Now, Juven is a medical food which features key nutrients to help support wound healing from the inside out. It has glutamine, which supports tissue development. It has arginine, which promotes blood flow and protein production. It has your micronutrients, vitamin C, E, B12, and zinc, which support wound healing. It has collagen protein, which stimulates internal collagen production, and it has HMB. Now, HMB is a metabolite of leucine, which enhances protein synthesis. So simply dosing 2 sachets of Juven per day in an 8 to 10 ounces of water or juice, we start to see results in as little as 2 weeks. Now, my last product slide is highlighting Pedialyte. And it's just a reminder that Pedialyte is no longer just seen as for children. Pedialyte replenishes fluid and electrolytes, and it provides hydration for all. Whether you're exercising, you're experiencing excessive sweating, enduring extreme heat, or whether there's vomiting or diarrhea, Pedialyte provides hydration for all. I've taken the liberty of putting in my business card with my cell number 4896093 and my email address, which is paul.russell, spelled with 1 L, @abbott.com. All our products are distributed by CareMed, and we're based at 20 Lady Musgrave Road, Kingston 5 in Jamaica. Should you have any questions, queries, or concerns on any Abbott nutritional product, feel free to contact me. Thanks again, and have an excellent webinar for the rest of the afternoon.
Thank you so much, Mr. Russell. Thanks for your presentation. Learned
Yes.
a lot, and I now know what products I need to buy for myself to keep staying healthy. Thank you
Yes.
so much. Okay, so the next item is really for me to do, and that is to introduce our next speaker. Our next speaker is Dr. Geoffrey Walcott, who is currently a consultant psychiatrist and clinical director at Psychotherapy Associates Limited. Their current project is psychohistoriography, and Dr. Walcott can correct me if I say anything wrong here with these terms. He's also a member of the steering committee and director of the preceptorship program for management of schizophrenia for Janssen Pharmaceutical Latin America and Caribbean. What I like most about researching on Dr. Walcott is his skills and expertise, and I found this very interesting. Psychosis, psychotherapy, mental health, mental competency, mental disorders, primary prevention, cultural therapy, psychodynamic psychotherapy. Wow. So his presentation topic this afternoon is understanding the science of sleep, stress, and burnout. And I'm sure that we are going to learn something from this and from his presentation. So let's listen attentively as Dr. Walcott provides expert insight into depression and burnout, exploring early identification, risk factors, and practical coping strategies. It's now over to you, Dr. Walcott. Welcome and thank you for participating.
Thank you so much. And thank you for having me. So this presentation is a little bit out of my area of comfort. I usually like presenting on things that are highly problematic or revolutionary. But sleep is an everyday thing that we all experience. So it did take me aback a little. But let me say that it's also one of the most critical and important activities that we engage in. And I'm hoping by the end of the presentation, we'll be able to understand more of the ways to enhance our sleep quality, and also how we recognize when there's a need for intervention when we're having challenges with sleep. So let's look at sleep patterns. Now, oftentimes when we think about sleep, we go to bed and we wake up in the morning and we think that's it. But it's actually a very complex process that we undergo, and we go through various stages. The stages of sleep can be broken down into two main phases: the REM sleep, or rapid eye movement sleep patterns, and non-REM sleep. And we go through these cycles throughout the night, probably 3 or 4 cycles every 90 or so minutes. And these stages set this space for different things. So we go through both physical rejuvenation and mental, psychological, and emotional rejuvenation during sleep in various stages. So the pattern goes as we move from wakefulness to actual heavy sleep, is that we go through periods, we go through stages that we have decreased consciousness, decreased awareness, and increased relaxation. And stage 1 and 2 basically is just a transition period that brings you down to deep sleep. Now, when you're at the level of deep sleep, your brain patterns become more organized and you have changes in how your brain functions. So you become exceedingly relaxed. And in this stage, you actually can get paralysis because once you're in deep sleep, you then transition into REM sleep. Now, in REM sleep, which is kind of paradoxical when you look at it, REM sleep, your brain patterns are almost identical to when you are awake. And it's that way for a specific reason, because REM sleep is the stage of sleep at which you are dreaming. It's where your memory consolidation occurs. It's where cognitive enhancement occurs. It's where your brain does its organization, structure, and repair. And the importance of the paralysis is when you're having dreams that you don't have an issue where you are actively reacting to them physically and run outside and do things in the night while you're supposed to be asleep. There are illnesses and disorders that can cause that, or conditions that can cause that. And certainly those are things that we often worry about. But those are basically phases and stages that you go through during a sleep period. And once you're in the phase of sleep, different things happen. Body temperature is usually regulated and lowered. Your breathing patterns are usually a lot deeper and slower, and your muscle tone relaxes. Now, when you're actually in deep sleep is the stage at which you actually get muscle repair and repair of other injuries, such as you talk about wound healing, skin repair. So deep sleep is important for your physical well-being and health. And then REM sleep is important for your cognitive functioning, memory consolidation, and also emotional processing. All right. So adequate sleep, as we know, is crucial for these issues and these things. And when we talk about adequate sleep, we're talking about for persons over the age of 10 to 12, about 6 to 8 hours of uninterrupted sleep for the night. And that does not change. So there used to be a thought that as you get older, you require less sleep. That's not the case. Well, as you get older, you still require the same amount of sleep, but you oftentimes have to do additional activities or things to enhance the quality of sleep, because the sleep stage that you lose as you get older is actually REM sleep, and we'll discuss why that happens and how we can counter it. Because as you recognize, REM sleep is exceedingly important for your cognitive functions, and as we age, cognitive functions are one of the things that we worry about as we get older. All right, physical activities, body repair occurs in deep sleep, and also there's important to recognize that sleep is very critical for your immune functioning. And so if you're talking about being prone to diseases, infections, etc., if you're not having adequate sleep, high quality sleep, you're also putting yourself at risk to be getting infections, colds, coughs regularly. Okay, so what are the things that cause disruption in sleep cycles? And how do you recognize your disruptions? And what are the different types? So you can have interference in both REM and non-REM sleep stages. And this disruption oftentimes leads to fragmented sleep, excessive daytime sleepiness, and it impacts your daily functioning because it affects your ability to concentrate. Now, in the early stages of life, surprisingly, one of the most common reasons for sleep disruption is teenage willfulness. In other words, it's usually deliberate bad habits of youngsters that use their electronic devices way into the night and early mornings, 4 or 5 a.m., and having conversations up, and they are deliberately impacting their sleep patterns, not recognizing that that type of activity is actually putting them at a disadvantage when it comes to academic performance and other cognitive skills and function, memory, and their physical health. So one of the most common things, if you have teenagers, you recognize it's usually the phones. That's the most common cause of disruptive cycle. But for other things that we can look for are, outside of poor sleep hygiene, we look at things that are common commonly associated with sleep disturbance are the mental or psychiatric disorders. And paradoxically, sleep disturbance tends to be an early warning sign for most, if not all, psychiatric illnesses, but also sleep deprivation can be a trigger and can induce a psychiatric condition. So when you're having disruptions in the sleep cycle, it's always significant and important to be screening your patients or looking at whether or not they may be developing or showing signs of some of the common psychiatric disorders that can cause sleep disruption. And we know that abnormal sleep patterns can lead to significant physical and mental health issues, including mood disorders, anxiety, cardiovascular problems, and impaired cognitive function. But what is interesting to note is that when we talk about the impact of anything, we oftentimes talk about the impact of cigarette smoking on lung health and on cardiovascular health down the line. But this is a case where the impact can be immediate. So for 24 to 72 hours of missing sleep, you can, in fact, and in most cases do, induce either a psychotic or a manic episode in persons who have no predisposition for mood disorders or psychosis. And I've recently had a flurry of patients that have had just that. One of the most interesting cases I'll briefly tell you about was a young teenager who had surgery to remove her wisdom teeth on both sides of her face. And normally, I remember from the ancient of days that you normally do one side at a time, but I'm not a dentist and I don't want to claim any knowledge in that field. But they did both sides, and for some strange reason, they thought it was a good idea that she would have pain on both sides of her jaw and could not find a comfortable spot to sleep. And she spent 2 to 3 days with absolutely no rest or sleep, and then ended up in my care in a hospital because she had high level, significant manic symptoms from sleep deprivation. And there are other cases where you had patients with work, similar pattern, missed 2 days of sleep completely, ended up with psychotic symptoms. So I want to underline it is very critical and important that we pay attention to sleep and sleep deprivation in our patients, because it can cause significant psychiatric and physical difficulties in our patients' lives. All right. So what are some of the common causes? We talked about the bad sleep hygiene, and incidentally, if you go on YouTube, there are tons of videos on how to develop proper sleep hygiene, which include not having electronics in the bed, only going into the bed when you're tired and sleepy, setting the room temperature to the appropriate level. But there are other issues that we can look at now in terms of things like chronic stress. I want to specify because I want to make the differentiation between chronic stress and don't want to say regular stress, but in fact, it is regular stress, anxiety disorders, and of course, hormonal changes due to aging and some congenital disorders, such as autistic spectrum disorders. They have a similar hormonal pattern that you see with aging. Irregular work schedules, and of course, you have medical conditions such as sleep apnea, which I'm sure you guys will discuss later. And addressing a lot of these issues is critical to restoring your normal sleep pattern. So for psychiatry, the more common illnesses that we see that affect sleep are the anxiety disorders and the mood disorders, in particular, major depressive disorder, as well as mania, bipolar mania. And how they affect sleep tends to give you an idea of which disorder you may be dealing with. So patients who are having anxiety disorders, it's oftentimes that they present with difficulty falling asleep. They feel like their brain is wired and they are not able to turn it off. And so they usually lie in bed for hours and hours and hours, and then they fall asleep and they have tiredness in the morning because they oversleep or they have to get up early, so they don't get the adequate amount of time. For your major depressive disorders and most depressive disorders, the sleep pattern is usually what we call middle insomnia. And middle insomnia clues you in there may be a depressive illness on board. What happens with the patient is that they fall asleep, but usually around 2 to 3 a.m., and they'll be specific on the time, they find themselves awake and they're having immense difficulty getting back to sleep. And when they do fall asleep again, they usually feel as though they are not rested, and they oftentimes feel as though they haven't had any sleep at all. And then for mania, you have no sleep. In other words, for mania, they tend to have less than an hour worth of sleep, and they just keep going high wired. And in those instances, hospitalization is inevitable. So it's important when you're doing your history with your patients, or even if you're experiencing some form of insomnia, to look at the pattern that you're exhibiting and to see whether or not it aligns with any of these common psychiatric or mental disorders. Now, I want to make the differentiation because we oftentimes talk about stress as if stress is a negative thing, but stress is a very important thing for growth and development. And in fact, one of my favorite conceptualization of stress is from physics, not medicine or psychiatry. Stress is defined as force per unit area, and in all aspects, it does the same thing. When you're experiencing stress, it is life forcing you to change. So when you apply stress to any object, force per unit area, two things happen. The object either moves in line with the stress to relieve the stress, or what you have is the object reorganizing itself so it becomes more resilient against the stress. So if you think of a shoelace that's tied to a ceiling and it's crumpled up and you add a weight to it, when you apply that weight, you see that it becomes taut and almost perfectly linear. So that's the same thing for dealing with stress in your life. You either move along with the stress or you restructure or reorganize your way of being, your patterns of behavior, so you are better able to handle stress. And that is why stress is important, because it oftentimes leads to both positive change, resilience, and development. However, if there's a state in which there's accommodation cannot be made, resilience is not developed, and you're not able to relieve the stress, and the stress remains at a very high level for an extended period of time, then that can lead to actual physical and psychiatric problems, where your stress now shifts into the realm of an anxiety disorder, major depressive disorder, where you're actually having debilitation and an illness that requires treatment. So understanding anxiety and burnout. Anxiety is marked by persistent worry and fear, which can be debilitating. Unlike stress, anxiety often lacks a clear cause and can continue indefinitely, increasing the risk of burnout if not managed effectively for both those illnesses. Because if you look at it from a biological standpoint, in those cases, what you're having is constant adrenaline rush on a day in, day out basis, and that puts every system that you have under pressure. And over time, you then get your hormonal response, which is usually corticosteroid driven. And we know all the challenges that we get when you have elevated corticosteroids, making you prone to infections, decreasing your immune system, prone to diabetes, prone to cardiovascular issues. So this is how stress converts into something that like burnout or anxiety. And part of the challenge is understanding how you need to restructure your life, your pattern of being, or the place that you're at, so that you are able to minimize or utilize the stress for your own growth and development. And it's important to make the distinction. So how does chronic stress affect sleep? Chronic stress alters your sleep architecture and making it difficult, similar to what we see when you have patients with anxiety, difficult to fall asleep as well as maintaining sleep. And the sleep stress response can lead to insomnia, very specifically disrupted rapid eye movement sleep cycles and changes in sleep quality. And it's important to recognize you do have conditions that specifically target REM sleep. MENA in particular does that. When you are having reduced quality of sleep, in other words, if you are still sleeping for 6 to 8 hours, but you're having reduced quality of sleep, where your REM sleep you're not achieving as much cycles of REM, then you are going to be waking up feeling exhausted, drained, and tired. And you're going to also wake up feeling fatigued, because REM sleep is that portion of sleep that helps your brain to recalibrate emotional processing, cognitive awareness, and it's what gives you the resilience level that you need to face the day. Memory consolidation. So if these systems are going to start breaking down, your ability to deal with day-to-day stresses is going to diminish, and you're going to constantly feel fatigue, which will lead to other problems along the way. And it's usually a very intricate cycle. Your circadian system, which is what regulates your balance in your sleep cycle, which is usually involving hormones such as melatonin, which is also very important. And we'll discuss melatonin and a few other drugs briefly. They help to regulate your homeostatic system, your arousal system, so that you have a regularized pattern of sleep. And sleep should be used at the same time when possible, at the same time every night, and when possible should be at night, because it helps to improve the quality of your sleep. And those issues like your circadian system, your arousal system, are affected by your behavioral practices and your emotional arousal. And so part of the issue is that you have to develop high levels of awareness in terms of what are the best practices to enhance your sleep pattern so that you can benefit from rejuvenation through sleep. Right? So types of insomnia we did, and again, we spoke about the middle insomnia and the early insomnia. When we're looking at types now, we're looking at the broad category of primary and secondary insomnia. And one of the things you may find very intriguing is this. Though 25% of adults experience acute insomnia at some point in their lives, the leading cause or the leading type of insomnia that most people experience is not primary insomnia, it's secondary. And that's often very intriguing because in most cases, when you think of a primary illness and a secondary illness, the prevalence of the primary illness is often the higher of the two. That's not the case with sleep. When you're having insomnia, it is more than likely that you have another underlying condition that is driving this problem. I have 10% of persons who experience chronic insomnia for their lives. 70% of people with chronic insomnia who also suffer from another mental disorder. 70%. And this includes your mood disorders, your anxiety disorders, as well as substance abuse disorders. So that's important to recognize. Not only is it much greater secondary insomnia, but it's almost the total amount of persons. It's 70% of your patients that suffer from that. And duration of defining acute insomnia is having this sleep disruption that lasts for more than 3 to 4 weeks, typically resolving with acute stress. All right. So, tired and wired phenomenon. What happens when you are tired and you get agitated, anxious, where your actual brain is preventing you from sleeping because it will not shut down and it keeps getting agitated? This phenomenon describes a state where you feel exhausted, but it's difficult to sleep because you're overstimulated, and chronic stress causes a release of your anxiety hormones that they themselves are stimulating and stimulate you. And in those instances, we use some amount of medication that can help to reduce anxiety and actually put you to sleep. I know there's a common practice to use more commonly for sleep disturbances, the short-acting benzodiazepines. But one of the things you have to recognize, and we'll speak briefly about the medication that's available, short-acting sedatives do not enhance REM sleep. What they do is that they put the patient into a deep state of sleep very quickly, but it does not necessarily enhance the REM cycle. There are only a few drugs, pharmaceutical agents, that will actually enhance REM cycle, and those include melatonin, which is a naturally occurring supplement, and also as you get older, melatonin should be a part of your daily routine of vitamin and supplements because you actually do need more melatonin, and we'll discuss later about why. Because it enhances REM sleep and it enhances your ability to have cognitive repair. The other medications are the long-acting benzodiazepines, which are quite readily available, which don't use a lot of. There's the clonazepam or Rivotril, and also there is one of my favorites, which has now resurfaced over time, which used to be used as primary treatment for generalized anxiety disorder. It's the clobazam or Frisium, which is very intriguing because clobazam actually works more effectively in enhancing REM sleep, which leads to one of its more common side effects. It tends to give persons vivid dreams or nightmares. So it's something that you have to work with. But those are the only agents that enhance actual REM sleep with your patients. Okay? Sleep disorders that mimic stress symptoms, sleep apnea disrupts breathing. Restless leg syndrome is not very common, but it's more common with persons who are under treatment for other psychiatric disorders like psychosis. A lot of the drugs that we use to treat our patients with psychosis can cause restless leg syndrome, which paradoxically made the patients seem as though they're getting agitated or more psychotic, but in essence, what they're doing is that they're reacting to the dose of the medication. And the management is to go down with the dose of the medication rather than up, or to use things like the antihistamines or benzodiazepines to help mitigate this syndrome. Narcolepsy can cause sudden sleep issues and circadian rhythm disorders with confused timing, which can occur because you have deficit in melatonin, either melatonin production or melatonin receptors. And a lot of our clients with autistic spectrum disorder, they do have challenges with circadian rhythms because their brains do not produce as much melatonin. And surprisingly, as you get older, we do see the same thing occurring because some of the hormonal change that occurs with age is that you actually produce less melatonin. So circadian rhythm disorders often are part of the problem. And in some instances, it can be induced because persons work with on shift or do night duties, and that can affect your circadian rhythm because the quality of sleep that you get in the night is not the same as you get in the daytime. So some of the hormonal changes that I mentioned that end up with age is that you have decreased melatonin production, which leads to altered sleep patterns, making it harder to fall asleep or remain asleep through the night. And also it causes you to have tiredness in the midday, afternoon. And so it's often a good idea as you get older to start incorporating small midday or late afternoon naps, which will also enhance your sleep pattern and your restfulness. Reduce deep sleep stages, increase nighttime awakenings, leading to a decline in overall sleep quality. However, this is one particular symptom similar to passing urine often in the night that I would say, before you accept that you're having frequent nighttime awakenings as a part of the natural process of aging, make sure there's not something else causing it. And incidentally, the same thing that causes you to get up in the night to pass urine could also be the same thing causing you to not be getting multiple awakenings in the night, which is diabetes and hypertension. If you're not having diabetes poorly controlled, you're going to have problems with sleeping. Same thing with hypertensive disorders. So it's important for you to ensure that you rule out everything else before you accept your nighttime awakenings as just a sleep issue that you're developing with age, because it's important to recognize that. All right? Strategies to improve sleep. There's a plethora of things that you can do, starting with proper sleep scheduling. And every time we say this, and I can't believe we have to say this continuously, but actual proper diet and exercise does wonders for enhancing and improving quality of sleep, ensuring that you eat appropriately and not 2 hours, don't eat anything 2 hours before bedtime, limit your fluid intake before sleeping, ensure that you are exercising, meditation activities, deep breathing, reading a book, gentle yoga. These are things that we are clear and we have been proven both help you in terms of your physical well-being, your psychological and psychiatric well-being, and also helps you with your quality of sleep. So these are things that we often take for granted, but we should pay attention to them. There's a reason why we keep saying them over and over again. And oftentimes when I tell people to exercise, the first thing that comes to their mind is going to the gym. You do not need to go to the gym. It will be helpful, but it's not necessary. You just need to start somewhere. And oftentimes a 30-minute or 45-minute walk outside continuously is sufficient to get the ball rolling. You just have to begin. Just start. Because you're waiting on gym membership, you're waiting on all these things. You just need to go outside and walk around for 30 minutes. Set an alarm and do that. It is very useful and important. Okay? So we talk about the circadian rhythm issues, and work stress and shift work oftentimes lead to induced circadian rhythm problems because you're going to work at night and you're trying to sleep in the daytime. So job-related stress can lead to insomnia, reduced quality of sleep. And some of the symptoms that you actually get to indicate that you're having job-related stress outside of the sleep disruption: headaches and fatigue, irritability and mood swings, difficulty concentration at work, muscle tension and aches, anxiety and constant worry. And you get muscle tension and aches specifically when you're not able to reach the third stage of sleep, which is deep sleep, which is where you get your muscle rehabilitation and healing that occurs in your muscle tissue. That's when you know that you're not having high quality sleep and the stress is actually impacting you negatively, and you need to explore some form of help. Non-traditional work hours disrupt natural sleep patterns and circadian rhythm, and oftentimes they are forced to lose out on sleep in order to meet life's many obligations. Because while you might be going to sleep in the morning, everybody else is awake, and oftentimes you have other things to do. Neighbors mowing the lawn. It can often lead to problems with mood regulation, which often puts strain on relationship, and they might become dissatisfied with their occupation and their life in general. So part of the issue is that you have to find a way to compensate, and it's oftentimes not recommended for you to be on late night shifts in perpetuity. So it's always good to find a balance, even though sometimes that may not be possible. Understanding sleep depth or cumulative effect of inadequate sleep and its long-term health benefits affects everything. It affects everything. It affects your mood regulation, you have irritability, cognitive impairment, memory loss, impaired moral judgment, increase and poor regulation of impulsivity and anger, hallucinations. 3 days without sleep, you can have a full psychotic episode. You can have symptoms similar to ADHD, impaired immune system, increased risk of type 2 diabetes, increased heart rate variability, risk of heart disease, increased reaction time, decreased accuracy for your muscles, causes tremors, aches, growth suppression. The list goes on and on and on. Sleep is one of the most important activity that you can do to help maintain wellness and health. It is a critical activity. And unfortunately, the young, impetuous youth that we have pay little to no regard to it, and they oftentimes are the ones that suffer in the long run because of their bad sleep patterns that they develop. No, so as a parent, you have to put your foot down and ensure that your children are practicing proper sleep hygiene, because long-term effects that they're going to get from this bad practice can be catastrophic. Right? Strategies discuss methods to mitigate the impacts of work stress and shift work on sleep. Recognizing early warning signs, the signs of chronic fatigue. If you're having muscle spasms, pains, you're not getting sufficient deep sleep, and you're not recuperating, so therefore you need to seek professional help. Performance declines over time. Emotional exhaustion is common. Detachment from work increase. And so understanding how sleep actually works and what are the things that can impact sleep and negatively affect it, and how to recognize when help is needed, and also to be warned as to the detrimental effects that can happen if the problem is not addressed, is very important for us and everyone else, so that we can take the appropriate steps before things are too late or before the damage is permanent and cannot be reversed. So by addressing these issues, we can enhance our mental health, overall well-being, and quality of life. And that, ladies and gentlemen, is my time. We'll do that later. I thank you so much.
And we thank you so much for your presentation. Somebody already said it for me. Excellent presentation. And now it's time, before I let the others, let the audience ask any questions. I remember years ago, I got this book called The Joy of Stress. And the author of the book was really talking about good stress and bad stress. Sometimes we put everything into the negative, when in fact there's some positives as well. Okay, so is there anyone on?
Hi, Doc. I think we lost Magdalena due to a power outage. The way that she just disappeared. Wonderful presentation. Seen excellent in the chat. Is this the time now for the Q&A, Dr. Kervin Dawes?
Yes, it is. And Magdalena is back though, but yes, it
Yes,
is.
I got
Can go
off, but
ahead and take over.
yeah, based on the agenda, I was seeing where now it's the Q&A from the attendees. So I don't know if we can ask 2 or 3 questions. Is that possible?
Please go ahead.
Okay, thank you. And then I'll hand over to Dr. Lisa. All right, sorry about that break, everyone, but it's good to be back on. Are there any questions? Although I think I saw one question in the chat. Anybody who would like to unmute their mic and ask a question?
There are a few questions in the chat. Sam, you want to read some of them?
You can go ahead and read them, Doc.
Okay. There is one that says, "What about soapitone and REM sleep?"
So Zopicon is a wonderful sleep aid, and it's useful. So let me recalibrate. The short acting are useful for persons who are having challenges in getting to sleep because they are very useful. But there are only a handful of medications that actually enhance REM sleep, and those are the long-acting benzodiazepine, the clonazepam and the Rivotril, because of how their actions are. So the sedation is not immediate; it is gradual. So it actually their sedative pattern acts more in line to what happens with natural sleep, and therefore you can get the REM cycles. Melatonin also, because it's a part of the normal circadian pathway, exogenous melatonin also enhances your REM sleep. So the Zopicon and the Xanax do not necessarily enhance your REM sleep, but they do help to put you to sleep if you're having problems with early insomnia, getting to sleep. And they also reduce anxiety, which is usually the problem that's causing it not to be able to go to sleep. So
And someone
there's
asked,
a place for them, but not for REM sleep.
and someone asked a question, what is the optimal dose of melatonin and what is the ideal time to take it?
So that's very important too, because there's a variation between 3 to 10 milligrams, and it depends on really on your need for it. There's not much sedative effect, but if 3 milligrams work, why waste the money by 10? The time to take it is actually very critical. Melatonin receptors present only during periods of darkness, so it's photosensitive. So it's usually best to take it right before sleep after you turn off the lights, and then you take the tablet and then go to bed. So it's always best to take them at nights. I had patients who said that they were going to take the melatonin in the daytime, which makes no sense because it wouldn't work because there's nothing to work on. So it's always used at night. And like I said, use it. You can gauge the dose for yourself because 3 milligrams work. It makes no sense using 10. But I've had patients that do 10, and it also depends. As you get older, your dosage requirement is different because you're actually having hormonal deficits because your ability to produce melatonin goes down with age. So it's important to recognize that when you're doing the dosing.
Okay.
And follow up of that question, because Magdalene, I'm not sure if you saw that. Another person said a lot of my patients would use melatonin report that the melatonin doesn't work even when paired with magnesium. So on the follow-up of that, what is the optimal dose for both? I just saw that to fit it
Yeah.
in
If
with
you're
what
taking
you just said.
melatonin and magnesium and it's not working, you need to see a psychiatrist. That is the critical thing because, like I said, 70% of persons that are experiencing insomnia, it is secondary insomnia. There's an underlying problem that is not being addressed. You're trying to address the symptom or the induction. You're not addressing the root cause. Something is wrong. If it's not working, something is happening and you need to get properly assessed.
So understanding sleep is very important to good health.
Yes, and it is not only is it important for good health, sleep changes are one of the earlier warning signs of psychiatric onset. So they are usually the first signs that we look for. And so it's important to recognize that any change in your sleep pattern, it requires you to actually investigate and check what's been happening and what's going on. There's a person that talk about drug holiday for melatonin. Again, melatonin, you don't need to take it continuously because if you what you're using the drug to do is to help your body's natural circadian rhythm get that pattern. It's like training your brain. So once you are able to sleep, you can take a break and try to do it naturally. But it's important to not allow for more than 2 to 3 days of poor sleep to continue because that starts to cause detrimental effects both physically and psychiatry.
Thank you so much for your presentation. It really was an eye-opener in many, many ways. And because this presentation is going to be on YouTube, and I know that people will want to go back and look at it, I'm sure you'll get a lot of people coming to see you and to find out how can they live better, especially in midlife and beyond. Over to you now, Dr. Lisa. Thank you very much, Dr.
My pleasure.
Walcott. Yes, thank you.
Excellent presentation, Dr. Walcott. There are a few more questions in the chat, so if you can answer them and we will post them on YouTube as well. And I was listening to this about what he said about naps, and I was saying, you know, when you're getting older, when happy hour is like a nap for us as we get older instead of drinking. All right, so our next are our sponsors, which will be Servicare first, which will be live, followed by Apex. Over to you, Sam, to set that up.
Good day, colleagues and friends. I'm Anne Bridgewater, consultant and chief radiologist at Apex Radiology. As a founding director and shareholder in the company Image Plus Consultants Limited, owners of Apex Radiology, I'm proud to share that we have been serving the Jamaican and Caribbean medical community for over 29 years, delivering compassionate patient care and the highest quality diagnostic and interventional radiological services. It is your continued support which has been instrumental in our growth, and we'd like you to know that we truly appreciate and value the important relationships we have developed over the years. As you know, we have 4 branches, 3 in Kingston and 1 in Ocho Rios, and our services include x-rays, mammograms, fluoroscopic studies, ultrasound studies, including Doppler studies and 3D obstetric ultrasounds, CT scans, including virtual colonoscopy, MRIs, including breast and prostate MRI at our Ocho Rios branch, and nuclear medicine studies. Also, we deliver interventional studies, including biopsies, abscess and cyst drainages, PICC lines, and other catheter insertions. I am pleased to announce that our 129 Pro branch in Ligani will be offering nuclear medicine studies in the comfortable and convenient location. In addition to our usual scans, most commonly our bone scans, thyroid scans, renal scans, and lung perfusion scans, we will be offering cardiac scanning to diagnose and monitor ischemic heart disease and heart function. We also continue to grow in the field of women's imaging with our mammographic services offered at our Malines Road and Ocho Rios offices. In 2023, we installed new state-of-the-art digital mammographic machines with tomosynthesis and 3D imaging. This allows patients to have pain-free mammograms with a higher degree of accuracy and up to 30% less radiation exposure. Yes, gone are the days of painful compression and pulling on the breast. It is often said, no pain, no gain. But at Apex, we say no pain and enough gain. So please join us in the fight against breast cancer by ensuring that all women in Jamaica, your patients, start their mammographic screening at the age of 40 years. We have invested in acquiring these machines, which make the procedure more comfortable, acceptable, and accurate. But it is up to you to educate, encourage, and implore our ladies to come and get screened. At Apex, we have gone one step further by investing in breast MRI with a large enough coil to scan any breast in Jamaica. On the topic of screening, I would like to also remind you of virtual colonoscopy or colonography in the screening for colon cancer. Yes, it is covered by health insurance, and it is also safer, cheaper, more comfortable, less invasive, less time-consuming, but yet just as accurate as conventional colonoscopy in diagnosing polyps 5 millimeters or larger. So it is an excellent screening tool for colon cancer, and patients can resume their normal daily activities as soon as they leave our offices. So remember, colon cancer is one of those cancers with an excellent survival rate if detected early. So let us keep our population healthy by referring all patients over 45 years of age for their virtual colonoscopy at Apex Radiology. So whether for early detection, diagnosis, ongoing monitoring, or treatment support, Apex Radiology is the clear choice for your diagnostic needs. Your #1 radiology center, completely committed to excellence in imaging and serving you, our referring physicians, and our patients. Thank you, and have a wonderful symposium.
Our next sponsor was Servicare, and we thank them very much. But unfortunately, they couldn't present today. But we do appreciate them and thank them very much for helping us and sponsoring us. Next, I am going to introduce our next speaker, which is Dr. Dionne M. Morgan. She is a board-certified physician in pulmonary, critical care, and sleep medicine. She earned her medical degree from University of the West Indies in Kingston, Jamaica, and completed her specialty training in internal medicine, pulmonary and critical care at SUNY Downstate in Brooklyn, New York, followed by a sleep medicine fellowship at National Jewish Health, University of Colorado in Denver, Colorado. She previously served as a clinical assistant professor of medicine, core fellowship teaching faculty, and staff intensivist, and has now transitioned to focus full-time in the specialty of sleep medicine. She has a particular interest in creating and integrating sleep pathways for patients with chronic respiratory failure and concomitant sleep disordered breathing. Welcome to Dr. Morgan. Over to you, Dr. Morgan.
Let me share my screen. Okay. Good afternoon, everyone. I appreciate the invitation to present at a 2026 Jamaica Midlife Health Society conference. So the topic for today will be on understanding sleep apnea. I have nothing to disclose. The primary objectives of this presentation is to review what is sleep apnea, review the different types of sleep apneas, obstructive, central versus mixed, to review how breathing normally works during sleep, why snoring is not always just snoring. I will also cover the signs and symptoms of obstructive sleep apnea, touch briefly on sleep apnea and the public safety issues, as well as the medical impact and why it matters, and mental health and sleep apnea, and then end with treatment options for obstructive sleep apnea. So, what is sleep apnea? Sleep apnea is a sleep disorder characterized by repeated episodes of complete or partial cessation of airflow during sleep, lasting at least 10 seconds in adults. The two main types of sleep apnea are obstructive sleep apnea, which is caused by upper airway collapse, and then there's central sleep apnea. This is now where you have complete cessation of airflow due to cessation of respiratory effort, but the upper airway is open. And mixed apnea, as the term implies, is a combination of both obstructive and central sleep apnea. So it is characterized by the central component first, where you have an absence of respiratory effort, and then it ends with the obstructive component, where you have continued respiratory effort, but no airflow detected. Now, obstructive sleep apnea occurs due to the intermittent collapse and closure of the upper airway during sleep, which leads to temporary pauses in breathing that then result in low oxygen levels and arousals from sleep. Many individuals may not realize that their breathing is impacted and so might not seek medical assessment. It's estimated that obstructive sleep apnea affects nearly 1 billion people worldwide. There is no significant racial difference in terms of prevalence. However, there is a gender predilection as it appears to affect men more than women. Okay, I'll move on to normal breathing in sleep. So breathing has a voluntary and an involuntary control. So when we are awake, both the voluntary and involuntary control of breathing are active, and it's the voluntary respiratory control that allows speech, swallowing, chewing. Once we are asleep, breathing is 100% controlled by the respiratory system, which is respiratory center, which is deeply embedded in the brainstem, in the medulla, and it's the automatic control of breathing that controls respiration while we are asleep. There are certain changes that are expected to occur during sleep. One, you will have a 1 to 2% fall in your oxygen saturation, as well as a 3 to 5 millimeter mercury change and the partial pressure of carbon dioxide because your respiration tends to be slower and more shallow. This also leads to a decrease in the metabolic rate and also decreased responsiveness to oxygen changes, which is further exaggerated during REM sleep. Respiratory muscle function is impaired, particularly during REM sleep. As Dr. Walcott mentioned, during stage REM, the body is paralyzed. So the only respiratory muscle that is active during REM sleep is the diaphragm. And so ventilation depends solely on the diaphragm in stage REM. You also get a reduction in the other accessory muscles of respiration, such as the intercostal muscles, which again leads to a decrease in ribcage contribution to respiration, and that leads to the shallow breaths while asleep. Now, snoring. Snoring is not equal to sleep apnea. Snoring is a possible symptom of obstructive sleep apnea, but you can have snoring without obstructive sleep apnea, and you can also have obstructive sleep apnea without snoring. During sleep, the upper airway muscles, particularly the tongue, the soft palate, and the throat muscles naturally relax to some extent. However, in obstructive sleep apnea, this relaxation may be excessive or insufficiently counteracted by muscle tone, and then it leads to narrowing or collapse of the airway. So snoring occurs as you get that partial obstruction of the airway, and then it can lead to complete obstruction of the airway, which we then term obstructive sleep apnea. As the airflow is obstructed during the apnea episodes, oxygen levels in the blood will decrease. This will then trigger a physiologic response, which includes sympathetic nervous system activation in order to restore normal oxygenation. So the sympathetic nervous system activation is going to trigger an increase in the heart rate, a spike in the blood pressure, increased tone in the blood vessels, and all of this can put strain on the heart as well as the brain, and in the long term can lead to cardiovascular complications, which I'll touch on later. So what are the clinical signs and symptoms of obstructive sleep apnea? The main risk factors first include, as I mentioned earlier, male gender, but obesity happens to be the #1 risk factor. Fat isn't just deposited on our legs, on our bellies, and our chest, but actually fat is deposited in the upper airway spaces and also in the tongue. And it has been shown that with weight loss, the tongue size can decrease, and that will help to contribute to a reduction in OSA severity or even resolution of obstructive sleep apnea. Other risk factors include enlarged tonsils and adenoids, which cause crowding at the back of the throat, a large tongue, a smaller recessed jaw, which may be a congenital or genetic abnormality, and then certain sedative medications, particularly the benzodiazepines and the opiates, as well as alcohol consumption and smoking, can increase the risk of obstructive sleep apnea. So common signs and symptoms include loud or irregular snoring, unrefreshing sleep regardless of the sleep duration, daytime sleepiness, increased fatigue in the daytime, and low energy level. You can have all three or you can have one. They're not interchangeable. Nighttime urination, which may in men sometimes be attributed to BPH, but at other times it may actually be related to underlying obstructive sleep apnea. Patients may report gasping or choking or coughing for air in their sleep, or their spouse or bed partner may notice this. Dry mouth on awakening is another common complaint, headaches in the morning. Patients may also report decreased concentration or alertness or memory lapses. On physical exam, their physician or their dentist may notice that they have a crowded oral airway and that they have a large neck circumference. In men, this is marked as more than 17 inches, and in women, more than 15 inches. The most common symptoms are usually the unrefreshing sleep, the excessive sleepiness, the daytime fatigue, tiredness, or lack of energy. Nighttime awakenings is also typical. Snoring is not specific to obstructive sleep apnea. Again, I will reiterate, you can have obstructive sleep apnea with no history of snoring. Nocturnal gasping, choking, and the witness apneas are the most reliable indicators that a patient likely has obstructive sleep apnea. Now, there are certain screening tools that have been used and developed for obstructive sleep apnea. There's a Berlin questionnaire, which was developed for assessing sleep apnea risk in a primary care setting. There's a stop bank questionnaire. This is 8 items, which assess snoring, sleepiness, presence of witness apneas, presence of hypertension or elevated blood pressure, obesity, that's a BMI greater than 30, neck circumference, age, and then gender, male versus female. And this was developed for sleep apnea screening in a preoperative setting, but has now been extrapolated also to the outpatient setting. It has a sensitivity of 90%, a specificity of 36%. And then there's the Epworth Sleepiness Scale. Epworth Sleepiness Scale is not really a screening tool for obstructive sleep apnea. It's more used as a screening tool to assess daytime sleepiness and then to subjectively track improvement in sleepiness and fatigue with therapy. It's a self-administered tool and it's scored out of a total of 24. And if the score is greater than or equal to 10 out of 24, then it's consistent with excessive daytime sleepiness. Now, the diagnosis of sleep apnea is not simply clinical. It does require a sleep study, whether it be an in-lab sleep study or a study conducted at home. So an overnight in-lab polysomnogram is the gold standard for diagnosing obstructive sleep apnea. However, home sleep apnea testing is a reliable alternative to in-lab PSGs for diagnosing uncomplicated sleep apnea in select patients. A diagnosis is made if the apnea-hypopnea index, so this is the total number of respiratory events, whether partial or complete airflow obstruction events, out of the total sleep time or total recording time. If the AHI is more than 5, then a diagnosis of obstructive sleep apnea can be made. However, sleep apnea is further characterized as mild, moderate, or severe. So mild sleep apnea is 5 to 15 events per hour. 5 to 14 events per hour. Moderate is 15 to 29 events per hour. And then severe is an AHI greater than or equal to 30 events per hour. The in-lab polysomnogram, as I said, is a diagnostic gold standard. It involves EEG leads, EMG, leg leads, EKGs, respiratory effort belts around the thorax and the abdomen, as well as oxygen monitor with a pulse oximeter and snoring monitors as well. So it is very detailed and it's the gold standard against which all other sleep testing devices are measured. This is a snapshot of an obstructive apnea event. So as you can see, the two areas that are flatlined, those are the respiratory effort belts, the airflow channels. And then you have the arrow pointing to respiratory effort belt. So the patient is having respiratory effort. There is movement of the thorax and the abdomen, but there is no airflow detected through the nasal passage. This is a diagram depicting an example of a home sleep apnea test, which usually is less complicated. It has an airflow channel. It has a thoracic effort belt. Some may also have an abdominal effort belt. It has oxygen saturation and heart rate monitor finger probe, and then the device is clipped onto one of the belts. This is another home sleep testing device known as the WatchPat. This testing device involves a watch, which again, the oxygen sensor, heart rate monitor worn on the index finger, and then the breathing sensor worn on the chest. The technology of the WatchPat uses peripheral arterial tonometry to help make the diagnosis of respiratory events related to sleep apnea. To summarize, the AASM, that's the American Academy of Sleep Medicine, published clinical practice guidelines for diagnostic testing of obstructive sleep apnea in 2017. They recommend that clinical tools such as questionnaires not be used to diagnose obstructive sleep apnea. They recommend that either a polysomnogram or home sleep apnea test with a technically adequate device be used for the diagnosis of obstructive sleep apnea. in uncomplicated adult patients with presenting signs and symptoms. They do recommend that if a single home sleep apnea test is negative or inconclusive, that a polysomnogram be considered to confirm or rule out the diagnosis of obstructive sleep apnea. So a home sleep apnea test is adequate to confirm obstructive sleep apnea, but should not be used to exclude obstructive sleep apnea. It's also recommended that a polysomnogram be used for the diagnosis of obstructive sleep apnea over a home sleep apnea test in patients with complicated medical histories such as chronic heart or lung disease, chronic insomnia, history of stroke, or opiate medication use. Now, OSA and public safety. It has been shown that untreated or undiagnosed sleep apnea can pose a significant public safety risk. The excessive daytime sleepiness and impaired cognitive function is associated with a higher chance of motor vehicle accidents as well as occupational accidents. And this is due to the impaired work performance, and that also contributes to reduced productivity. The American Academy of Sleep Medicine does recommend screening and treating obstructive sleep apnea in safety-sensitive occupations, such as Department of Transportation or woodworkers, truck drivers. And in the United States, all commercial airline pilots are screened for obstructive sleep apnea and must prove appropriate adherence to therapy in order to maintain their pilot's license. Now, the medical impact of sleep apnea, does it matter? Yes. Why does it matter? Let's look at clinical outcomes. Let's first go back to the pathophysiology again of obstructive sleep apnea. So with the closure of the airway, this puts the body under stress because for those 10 seconds, you are not breathing. So the intermittent hypoxemia, sleep fragmentation, and large interthoracic pressure swings leads to oxidative stress, activation of the sympathetic nervous system, disruption of the hypothalamic pituitary adrenal axis, and also increases stress on the heart, increased cardiac preload and afterload. Then this leads to phenotypic consequences, which initially are subclinical. Spikes in blood pressure, it starts at night. Patients may notice that their blood pressure is usually highest in the morning and improves in the daytime. Metabolic dysregulation, increased insulin resistance, systemic inflammation, endothelial dysfunction, and myocardial dysfunction. And in the long term, the patients will then present with the disease endpoints of hypertension, type 2 diabetes, coronary artery disease, cerebrovascular disease, arrhythmias, and even heart failures. So what we do know is that there are potential benefits to the treatment of obstructive sleep apnea. It has been shown that treating obstructive sleep apnea is associated with decreased healthcare utilization, decreased risk for dementia, decreased atrial fibrillation, and improved responsiveness to atrial fibrillation therapy, particularly ablation therapy, and also reduction in congestive heart failure and coronary artery disease incidence. It's also been associated with improvement in blood pressure and blood pressure control, blood pressure readings, reduction in motor vehicle crashes and excessive daytime sleepiness, and improvement in sleep-related quality of life. The clinical data right now is still ambiguous as to whether there is a true improvement in mortality or not. It could be extrapolated that because there's a trend towards reduction in cardiovascular morbidity, that would then trend towards reduced cardiovascular mortality. Meta-analysis have shown that PAP therapy does result in clinically significant reduction in both nighttime and daytime systolic and diastolic blood pressure readings. So one thing we know for sure is that treating sleep apnea does improve blood pressure control. And treatment of sleep apnea has also been shown to improve OSA-related sleepiness and the sleep-related quality of life. So as Dr. Walcott mentioned, OSA is associated with increased risk of mental health disorders, particularly depression and anxiety, and sleep apnea itself may be an independent risk factor. There is significant overlap between the symptoms exhibited in depression, anxiety, and obstructive sleep apnea, such as poor sleep quality. Studies have shown that attention, working memory, episodic memory, and executive functions are decreased in obstructive sleep apnea. And obstructive sleep apnea, if left untreated, can have an impact on psychiatric disorders and lead to further decline in cognitive function. All right, we'll now review therapeutic options for obstructive sleep apnea. So there are various available therapeutic options at this time. There's positional therapy, positive airway pressure therapy, oral appliance therapy with a mandibular advancement device, ear, nose, and throat surgical options, hypoglossal nerve stimulation with the Inspire device, focusing on weight loss, lifestyle modifications, and in the last 2 years, the FDA approved drug tirzepatide, the GLP-1 receptor agonist for weight loss. Positional pillow therapy can be considered because some patients with obstructive sleep apnea tend to have respiratory events only when in a supine position, supine meaning sleeping on their back, and then they have no sleep apnea episodes or minimal sleep apnea episodes when lying on their side. So on sleep study reports, we usually document if there is a difference in the HI in the supine versus non-supine position. The purpose of the positional pillow therapy is to wear a pillow that helps to physically restrict one's ability to lie on their back, and so instead keeps one on their side or even prone. There are commercially available positional pillows such as the Slumber Bump, which is available on Amazon. The Z-Zoma pillow, as indicated in the image, is the only FDA-approved positional device for mild or moderate sleep apnea. Positive airway pressure therapy, however, is the first-line recommended therapy for individuals with symptomatic obstructive sleep apnea, regardless of severity. Positive airway pressure acts as a splint to prevent the airway collapse during inspiration while asleep. It normalizes the HI in more than 90% of patients. So as long as patients can tolerate the pressure and the mask at night, the CPAP therapy is usually effective. We have found that the benefit does depend on adherence to therapy, with more hours of use per night being associated with greater symptom improvement. At least 4 hours a night is recommended for at least 5 nights a week. So that's 70% adherence. In the past, patients would have to do 2 sleep studies, first a diagnostic polysomnogram, and then a second study, a PAP titration study, to determine the optimal pressure that results in normalization of the HI. Fortunately, technology has improved, and we now have automatic titration PAP devices, which facilitate faster initiation of PAP therapy once the patient has undergone whether a diagnostic polysomnogram or a home sleep apnea test that confirms the presence of obstructive sleep apnea. The image with the device is a ResMed AirSense S10. This is one of the auto-titrating PAP devices available on the market in the US, in Europe, and also here in Jamaica. And then the other image shows different types of CPAP masks. The full face mask is usually not recommended. We have found that the nasal mask and the nasal pillow mask are better than a full face mask. 1, in terms of comfort, and 2, patients tend to need lower pressures with the smaller nasal mask over the full face mask. Oral appliance therapy is another reasonable treatment option, specifically for patients who have mild to moderate obstructive sleep apnea. It's been shown to be non-inferior to PAP therapy. It's not really indicated for severe OSA, but the AASM does suggest consider it over no therapy in patients with severe OSA. The premise of the oral appliance, which does have to be created by a dentist, and one must have adequate dentition, is that when you wear it at night, it will shift the jaw forward to open the airway and improve breathing and prevent the upper airway collapse. Hypoglossal nerve stimulation, or as I like to tell patients, the tongue pacemaker, is therapy that was developed approximately 10 years ago now. The STAR trial was published in 2014. And It involves a pacemaker that's implanted on the right side of the chest. There is a lead that's implanted into an intercostal muscle, and then another lead is implanted into the hypoglossal nerve. So when the patient breathes, the intercostal muscle lead will trigger the pacemaker to then move to stimulate the hypoglossal nerve lead to move the tongue forward. And this increases the pharyngeal dilator muscle tone during sleep and opens the airway. This happens to be perhaps the most expensive therapy available for obstructive sleep apnea. And this is certainly more costly than PAP therapy or oral appliance therapy. However, it is a reasonable third or fourth line treatment option to consider, particularly for patients who have PAP intolerance. There are, however, qualifying criteria. It is not indicated for mild sleep apnea. It is indicated for moderate or severe sleep apnea. The patient must have a BMI less than 40. They must have documented history of CPAP intolerance. They should not have any complicated cardiopulmonary or neuromuscular disease or primary central sleep apnea. And they will have to undergo drug-induced sleep endoscopy with sleep ENT or any ENT to confirm that they have non-concentric or anterior posterior collapse of the airway as opposed to circular or what we call concentric airway collapse. Weight loss is effective therapy for obstructive sleep apnea as well, but we know that this can take time. OSA severity does improve with weight loss. A 10 to 20% reduction is usually recommended. Weight loss options, of course, include that with exercise, weight loss medications, and bariatric surgery. Tirzepatide is now approved by the FDA as of December 2024 for weight loss therapy in patients with obesity and moderate or severe obstructive sleep apnea. The SURMOUNT OSA trial, which was published in the New England Journal of Medicine in 2024, compared tirzepatide with or without CPAP and found that there was a significant reduction in the apnea-hypopnea index in patients with moderate or severe obstructive sleep apnea. And it is now being prescribed in the United States, and it is also approved in Europe and the United Kingdom. So in conclusion, this table summarizes the main treatment options for obstructive sleep apnea. As mentioned, weight loss, exercise, lifestyle modification, the sleep position restriction with positional pillows. Again, I'll reiterate that positive airway pressure therapy is the first-line recommended therapy for sleep apnea, regardless of severity. However, patients who may not want to proceed with PAP therapy or who are intolerant can consider other options, such as the oral appliance device. And in terms of surgical options, I often have patients asking, well, what about we call it the UPPP, the uvulopalatal pharyngoplasty. It's not a curative surgery. There really is not any curative surgery for obstructive sleep apnea except for tracheostomy, whereby you are completely bypassing the upper airway obstruction. So that is really the only curative surgery. And again, minimally invasive surgical options include the hypoglossal nerve stimulation. The maxillomandibular advancement is a cosmetic surgery that can be considered for patients who have a recessed or very small jaw or craniofacial abnormalities. But again, PAP therapy is the first recommended treatment for sleep apnea. Thank you.
Thank you. That was a lot of interesting information, a lot of knowledge that you provided to us. We all appreciate it. I know I learned a lot. I have a question though. The tirzepatide, in comparison to the other, say the Ozempic and Mounjaro, is it the latter, well, the former, is it because it loses more fat around the neck? Or could you use one of the others? Because we don't have tirzepatide in Jamaica.
Right. So the tirzepatide is the only GIP therapy that was studied specifically for obstructive sleep apnea. So right now we don't know if could Ozempic or Wegovy work. What we do know is weight loss by whatever method you choose does work. And if you can
Yeah.
achieve 10 to 20% weight loss, it will be effective. I personally, in my clinical experience, have found I've had patients that were on Wegovy, they switched to the tirzepatide, and they actually achieved greater weight loss with the tirzepatide. As to why that is, it may just have to do with the mechanism of the drug's action. But again, the tirzepatide is the only one that's indicated and approved right now specifically for sleep apnea. Mounjaro is tirzepatide, just marketed under a different name, and that's indicated for diabetes and coronary artery disease.
Well, the reason I was asking if the person has sleep apnea, then we should preferentially use tirzepatide.
Correct. Yes. If the person has sleep apnea, then yes, you should preferentially use the tirzepatide. Yes.
Okay. We have some questions in the chat. And I'm going to look at the Q&A if I see them, or Sam will help me. How accurate are smartwatches to monitor sleep cycles?
Great question. They're not accurate at all. There are clinical trials that have actually compared them to the polysomnogram, which is the gold standard. They're not accurate, but they're valid. So, and they're reliable. So we found that they're not accurate in actually confirming stage N1, N2, or N3 sleep, which is deep sleep. However, they're fairly accurate for confirming REM sleep, because REM sleep is a very unique stage of sleep where your body is completely paralyzed. And a lot of times these smartwatches and wearable devices, they're depending on micro movements in the body to determine if one is really asleep or not. But the data is valid, especially for trending therapy. So if a patient comes and says, I'm only getting 5 hours of sleep, and the watch shows the average is maybe 4.5, and we treat their sleep apnea or treat their insomnia, and then we see that their sleep time has extended, and we can confirm that objectively with the watch. So the wearable devices have a role, but in terms of accuracy, unfortunately, they're not accurate at this time when compared to the gold standard, which is the in-lab sleep study.
And on that, how much is lab polysomnography?
How, as into the cost?
Cost, yes.
Oh, okay. So in the United States, the sleep studies are covered by the health insurance, and out of pocket, the in-lab sleep study is about $5,000. And then if it's covered by the health insurance, Medicare, it's usually free. Medicaid also, it's free. And then the commercial health insurance, depending on the lab, depending on the state, it may be anywhere between $500 to maybe $1,500.
How does the hypoglossal nerve stimulation affect sleep breathing?
How does it
Say
affect?
non-sleep breathing. That's what it says. How does the hypoglossal nerve stimulation affect non-sleep? Not sure, breathing.
Oh, okay. I think I understand. Right. So, I didn't emphasize that in the presentation. The device isn't on all the time. It's turned on only at night. So I had shown it in the presentation. There's a little remote, and so the patient will turn the device on by pressing the remote, and in the morning they turn it off. If they leave it on, if they hold their breath, the tongue will actually, if we turn it on, every time they breathe, the tongue will shoot forward. So they do have to turn it off in the morning.
And I think this is the last question, unless Sam sees more. Is there any study on the impact of sleep apnea, especially with snoring on relationships?
There probably is. I don't know of any offhand, but they might be. What we do know is that sleep apnea and snoring doesn't just disturb the patient, sometimes it disturbs the bed partner more, and it's a bed partner that then encourages the patient to get checked out and to undergo therapy. And I have found that the bed partner is a strong supporter of encouraging the therapy, and then everybody is happy.
And somebody is answering the question for you. In Jamaica, an in-lab PSG may cost $198,000, and there is no upfront insurance coverage for it.
Right, that's correct. In Jamaica, there isn't any upfront insurance coverage. Thank you.
Excellent. I've learned a lot. Excellent. Sam, is there anything else we didn't cover? Because we do it.
Not that I'm seeing. I think we got all the questions as well.
Thank you.
Okay. Excellent, excellent. We're gonna we'll now go over back to our sponsors. Our first sponsor will be Mediplex, followed.
Greetings, my name is Sasha Dixon and I'm a medical representative with Medimpex Jamaica Limited. Thank you for having me here today, presenting to you on enhancing cognitive vitality, the role of Stimuloton, Cavington, and Palixid in lifelong brain health. Stimuloton is our brand of sertraline. It is offered in a 50 mg strength and it is a selective serotonin reuptake inhibitor. Stimuloton is indicated for depression, panic attacks, obsessive compulsive disorders, and post-traumatic stress disorder. Stimuloton acts within the brain to increase the amount of neurotransmitter serotonin in the synaptic gap by inhibiting its reuptake. Dosage for depression and OCD is 50 mg once daily with food, and complete therapeutic effects can be seen after 2 to 4 weeks. For panic disorder treatment, in week 1, it's 25 mg once daily with food, and in the second week, 50 mg once daily with food. Complete therapeutic effects can be seen after 8 to 12 weeks. And there's a maximum allowed daily dosage of 200 mg. For post-traumatic stress disorder, the daily dose of 50 to 200 mg is what is required. Start with a smaller dose, and then it can be considered to increase it slowly as needed. Stimuloton can be used off-label for the treatment of premature ejaculation. It's required as 50 mg once daily for 6 weeks, and then when needed thereafter. As prophylaxis, it's 50 mg PRN 2 hours prior to sexual intercourse. No dosage adjustment is really necessary for Stimuloton, except for your hepatically impaired patients, where you may need either a lower dose or the usual dose is done with longer dosage intervals. Safety is not established in pregnancy, and Stimuloton is also found to be excreted in the breast milk. With Stimuloton, we're offering choice to your patients. Stimuloton retails at approximately $180 per tablet. It is covered by the NHF. So what this means is that the patient will pay approximately $135.86 per tablet after NHF coverage. Now let's talk about Palixid. This is our brand of donepezil hydrochloride, and we offer it in a 5 mg and 10 mg dosing. The therapeutic indication is for the treatment of mild to moderately severe Alzheimer's disease. Palixid is a cholinesterase inhibitor. It is a specific and reversible inhibitor of acetylcholinesterase, which is the predominant cholinesterase in the brain. Palixid is postulated to exert its therapeutic effect by enhancing cholinergic function through increased concentration of acetylcholine. Please note that there is no evidence that donepezil alters the course of the underlying dementing process. Palixid is well tolerated. It improves cognitive and functioning. There is a 38% reduction in functional decline. It improves behavior symptoms. And any adverse effect seen can be bradycardia, GI, muscle cramps, or fatigue. Dosage is simple. Initial dosage of 5 mg once daily in the evening before retiring for at least 1 month. After 1 month, then you'll assess the patient to see if the dosage needs to be increased to 10 mg. There's a maximum allowed dosing of 10 milligrams daily. For renally and hepatically impaired patients, same dosing is required as the clearance of the drug is not affected. And again, please note, Palixid is not recommended in children. As stated before, it's offered in a 5 and 10 milligram presentation. Palixid will retail at approximately the 5 milligrams, approximately $11,186 per month, and the 10 milligrams, $12,684 per month. However, it is covered on the VEN list for your patients. So that is a very big plus. Now let's talk about Cavintone. This is our brand of vinpocetine and it is offered as a 10 milligram strength presentation. Cavintone is a semi-synthetic derivative of the alkaloid vincamine, which is derived from the plant Vinca minor, a member of the periwinkle family. It is a cerebral vasodilator which has neuroprotective and cognitive enhancing effects. It is used for the treatment of a wide range of cerebrovascular insufficiencies. Cavintone increases cerebral blood flow, cerebral microcirculation, cerebral metabolism, and cerebral functioning. Indications of Cavintone: post-ischemic stroke, for memory disorders, treatment of tinnitus and dizziness of the labyrinth origin, vertigo, as well as vascular dementia. Any contraindications concerning Cavintone? Not to be used in pregnancy, not to be used by nursing mothers, not to be used by patients who have a known allergic reaction to Vinca alkaloids, not to be used in patients with severe ischemic heart disease, nor in severe arrhythmias, and especially not recommended for patients who have experienced a hemorrhagic stroke. Dosage for Cavintone, again, very simple and convenient. 1 tablet 3 times daily with food. There are no known drug interactions, and the drug can be safely administered in combination therapies. Minimal changes in prothrombin time when taken with warfarin. Any possible side effects that can be seen is transient hypotension and transient tachycardia. However, there are great benefits for prescribing Cavintone to your patients. There is a powerful cognitive enhancing that you will see in your patients, meaning it sharpens mental acuity and memory. Cavintone also improves cerebral blood flow. It is safe, and there is no systemic circulatory effects. And a very big thing, Cavintone is available on the JADEP. So roughly $40 per month is what your patient will pay. It is also covered by NHF at $94 per tablet. Thank you very much for having me today, and please enjoy the rest of the evening. Thank you.
Fast news, smart takes, real stories. The Jamaica Observer keeps you ahead, online, social, and in print. From breaking headlines to bold opinions, business, sports, lifestyle. We cover what matters to you. Clarity, credibility, culture. We deliver all three. The Jamaica Observer, always ahead with news you can trust.
Dr. Brown Morgan, over to you.
Okay, then are we having us a second sponsor right here, PA Benjamin Manufacturing?
I think that was under the Observer. It's a little confusing how they did it, but it's part of the same thing.
Okay, all right, thank you. Well, I just would like
Yeah, I was a
to
little
say,
confused too.
I'd like to say thank you so very much to my previous moderators. That would be Mrs. Magdalena Cooper de Nuez and Dr. Lisa Kervin Dawes, who have just done an excellent job for the day so far. This is going to be my pleasant task now to welcome our third presenter for this evening, Dr. Brian Kazaara. And this is a very special gentleman who doesn't like to be promoted too well. He provides very little information on himself, and so one has to go looking it up. But Mr. Dr. Brian Kazaara is a psychiatrist with a very strong passion for mental health. And he earned his medical degree from the University of the West Indies. And he then completed his specialty training by getting a Doctor of Medicine Psychiatry, also from the University of the West Indies. He is the current president of the Jamaica Psychiatric Association, and he's a former vice president for the Jamaica Medical Doctors Association. So very wide and very involved in our medical community. And as president of the Psychiatric Association, Dr. Kazaara has called for more protection of the elderly and for persons to report abuse of elderly people. So he's very much a part of what we do here at JMHS, which is trying to promote good health and healthy lifestyles for older people. And according to Dr. Kazaara, the good news is that stress can be managed and often prevented. The key is intentionality, which begins with setting boundaries, particularly between home and work. And he has advised in social media that we should try not to take work home with us as much as possible. We should have a cutoff time. Protect yourself, protect your work, protect your social life and your space from being overtaken by work. Ultimately, managing stress is about awareness. And Dr. Kazaara says that in a world that equates rest with weakness, reclaiming peace is becoming an act of strength. So slowing down isn't falling behind, it's choosing to protect your health before burnout begins. So this is Dr. Kazaara. Dr. Brian Kazaara, I hope I have encapsulated a little bit of what you think, who you are, and what you bring to us generally in the community and here this evening. Over to you. You're going to present to us on treatment, evidence-based, non-pharmacologic and pharmacologic interventions. So over to you, sir.
Yes, good afternoon. Thank you so much, Dr. Brown Morgan, for such a wonderful introduction. I hope everyone can hear me clearly. And I really have to say that I'm surprised and flattered to be on this platform again. When Dr. Brown called me to say that, I was invited to present for this seminar for the third time in a row, I was flattered, and I really do appreciate you guys having that confidence in me and allowing me this platform to talk about a topic topics actually over the years that have been very important to me, and this topic here, which I think is very important. So we're talking about sleep and treatment options. I think Dr. Walcott and Dr. Morgan very competently covered some aspects of sleep treatment. So I see my presentation as a kind of wrapping up of what we've discussed so far today. It's going to be very short because I think that we've already had very stimulating and interesting conversations on sleep. And thankfully, because Dr. Walcott and Dr. Morgan did such a excellent job highlighting the science behind sleep. I see this presentation as a more practical, down-to-earth discussion on what we can do to improve sleep. I'm purposely trying not to include a lot of what Dr. Walcott or Dr. Morgan would have mentioned already, because I think they did an excellent job communicating their points. So I'm just trying to add a little bit to the discussion, and hopefully you guys find it valuable. So let's begin. So, when I think about what happens to the body during sleep, we always remember that the eyes are closed, the muscles are relaxed, and there's a lot of activity in the brain that's being altered. So our eyes, muscles, and brains are some of the key organs that are being impacted during sleep. Dr. Walcott would have gone over some of the functions of sleep, and I just thought it'd be a useful reminder. So we actually do have some degree of neural detoxification during sleep. Some of the waste products of sleep are adequately removed. I mean, the waste products in our brain are actually adequately removed during sleep. We have memory consolidation, and that is the process of going from short-term to long-term memory. We know a lot of that occurs during sleep. So it generally is very good for our memory. It's very useful for muscle repair. I think a lot of us that have used the gym know that. We know it plays an important role in promoting good immune system functioning. Again, a lot of us firsthand can speak to this. I certainly can. I know that I can actually almost time it. If I'm going through a week where I'm having very limited sleep or a significant reduction in the quality of sleep, I know that it's much more likely that I might get some of the common upper respiratory tract infections, or my sinus infections in particular, usually occur during that time. And of course, emotional regulation. All of us know how sleep can impact our mood. So sleep is very important. What are the consequences of poor sleep? So we have cognitive and emotional issues, some memory problems, difficulty concentrating. Studies have shown time and time again that students that get higher quality of sleep perform better. Staff that get higher quality of sleep perform better in terms of their occupational tasks. It also affects mood changes and stress. And as Dr. Walcott would have highlighted, there's a very clear relationship between sleep and some of our common mental health conditions. There are medical conditions that are caused by poor sleep. And if you look on it, it's quite significant because these are very common conditions: hypertension, diabetes, obesity, cardiovascular disease. These are some of the most common conditions in Jamaica. They start for a lot of people, they start during midlife. So we see the relevance of discussing that in this forum. And also, these conditions are some of the major killers of Jamaicans. When you look at the top 10 most common causes of death amongst Jamaicans, you see these right on top of the list. And these conditions are actually caused or exacerbated by poor sleep. So it really speaks to public health importance of sleep, the clinical importance of sleep, and why we as healthcare providers or just persons in the audience who have any kind of interest in midlife health and healthy aging need to appreciate the importance of sleep. This slide looks like it's the same, but really I just switched it around. The first slide before this talked about medical conditions caused by poor sleep. But it's also important to note that these conditions also cause poor sleep. So it's the cause and effect. So what that really says to us is we know the importance of controlling these conditions in terms of mortality. We know that if we get hypertension and diabetes and obesity and heart conditions under control, that Jamaicans live longer. But I also want to stress that when we get these conditions under control, that Jamaicans live better. And so it's really important that as we think about sleep, think about all the surrounding issues and medical conditions that cause sleep, which for me is really the essential message of my presentation. That not only is sleep important, but we have to pay attention to all the factors and surrounding issues when it comes to sleep. So what are some of our non-pharmacological treatment options? So we have what's called mindfulness-based stress reduction. It's an 8-week program. It's a very structured and interesting program. I decided not to go into all the minutiae with us today, but rather just to bring it to everyone's attention. It includes what are classic practices that have been shown to assist with sleep and calmness for centuries. Things like meditation, yoga, and body awareness practices. Very fortunately, there are a lot of excellent resources available that go into all the detail of mindfulness-based stress reduction. And I'll be very comfortable sharing some of those links with you in the chat. But what I want to emphasize is that this is actually an evidence-based system that has been shown to promote sleep. So for us, for those of us who are practitioners in the audience, this is something that we can become well acquainted with and perhaps add to our list of options when we're trying to promote better sleep for our patients. I don't know how many amongst us are comfortable guiding persons in things like meditation or yoga. If some among us are, then of course you can perhaps introduce this into your practice if you haven't already. But even if you aren't, fortunately, we do have yoga studios. We do have persons very competent and confident in going over these things. So with the mindfulness-based stress reduction program, what you can do is kind of cater a program using some of our local services and resources to help persons attain better sleep. Science has shown that when persons actually undergo this program, it improves sleep quality. It reduces pre-sleep arousal, which is so important, and it manages insomnia. Let's look at another approach that we can take, and Dr. Walcott would have touched on this. Chronotherapy and circadian alignment. Dr. Walcott did a really good job outlining exactly the circadian rhythm or pattern is and its importance in maintaining adequate sleep. So I think everyone here can appreciate how useful light therapy can be to individuals. In Jamaica, that's not necessarily something that you necessarily frequently have to use, could still be quite useful in certain settings. Melatonin administration, Dr. Walcott did a great job of actually going over how it should be administered. And that's in part thanks to this very engaged audience that were asking appropriate questions. So again, I don't even think I need to go over that. I think he did a superb job. Time-restricted eating is something he also mentioned. We know that generally it's best not to eat too soon before you want to go to bed. So it's best that you restrict it to usually more than 2 hours, I should say, before you want to go to bed. And pharmacological timing. A lot of times, as a psychiatrist, when I'm prescribing my medication, I know that they may affect sleep. Some of the medication I prescribe has sedation as one of the common side effects. And so what we tell persons is to time it appropriately. And there is a great degree of idiosyncratic variability in terms of what time works for some patients. I found that for some patients, if I start them on a psychotropic medication that may cause them to sleep, that same medication might be more useful to start 1 hour before they want to sleep versus another medication that might be more useful to start 2 or 3 hours. So I tell persons to experiment and see what works best for them. We do have some general guidelines, of course, but generally speaking, it's more useful to allow them the opportunity to, by trial and error, figure out what works good for them. But I think what's important for us as healthcare providers, and of course, healthcare utilizers, is that we appreciate that even if it is that the timing of the medication, our first attempt at timing the medication doesn't turn out well, that doesn't mean we should stop the medication. What it means is now we need to try another time. Because I have come across quite a few patients who were discouraged because with how they timed the administration of the medication, they felt they may have gone to bed too early or too late or things like that. So rather than, it's good for us to counsel them so that they appreciate that this can be a dynamic process, right? I just wanted to show this picture. I'm not really a fan of pictures in my presentations. I think many of you probably realize that by now. But I just wanted to emphasize the importance of going for reputable brands when looking at supplements, because we are going to talk briefly about some of the dietary supplements. Nature's Bounty is one of them, but there are many out there. I just chose this one because I know this is available locally, and I see it in many, many pharmacies across Jamaica, this brand that is. But the truth of the matter is most studies are clear that there's not necessarily huge difference amongst brands. But I do want to emphasize doing your homework and ensuring that you're looking at reputable brands when trying to use supplements to assist with sleep or recommending or prescribing supplements sleep. So what are some of the common supplements? Again, some of these would have been mentioned before. Some of you would be very familiar with them. Magnesium, valerian root, L-theanine, chamomile, glycine, and zinc. A lot of these are widely available in our pharmacies, thankfully. And what I have found, having recommended some of these, magnesium in particular is quite popular right now. I found that these are, a lot of research shows that all of these have very good sleep promoting qualities. The extent to which they can treat insomnia, though, is still up for debate, with valerian root appearing to be the supplement that most consistently can help with insomnia. But it's clear that when it comes to treating insomnia in particular, the verdict still isn't out on how effective these supplements are. And for me, the key thing I want you to get from that discourse is this. These medications do help. I mean, these supplements do help sleep. If you're someone who has a suboptimal quality of sleep, then taking these supplements does increase the likelihood that you are going to get better sleep. Generally, persons get better sleep on this medication. But when it comes to treating insomnia in particular, right, which is a difference, we can have suboptimal sleep without it necessarily being insomnia, or have less than desired sleep without it being insomnia. The research still isn't 100% consistent on how effective these are. Nevertheless, they're generally cost effective, and most of them don't have particularly adverse side effects. So you still should and can recommend them to your patients. Sorry, guys, I'm just getting one call. I can't take more. Just give me 1 minute.
Doc, we're not hearing.
Yes, I put it on mute. I had a call that I couldn't ignore.
Okay.
Yeah, man. So the point I was making is these are generally widely available, cost effective, with very limited adverse side effects for most adults. So they're certainly worth exploring. I have seen good results starting these medications. But it's important that we set realistic expectations, because generally Jamaicans prefer not to use pharmaceutical drugs, which is fine and that's actually normal anywhere in the world. So introducing these options can sometimes be very encouraging. And I think we can, in some cases as practitioners, maybe sometimes we underutilize these supplements. But I also think it's important to counsel them and set realistic expectations, because sometimes the impact that patients may expect may not match up with what they in fact experience. Also, know that so long as you're careful, you can actually combine some of these supplements. I've actually found that for some persons, combining magnesium with zinc can be quite useful. So that also is important and something to look at when considering supplements. Over-the-counter medication, the ones that are most commonly available are DPH and Unisom. Not, DPH in particular, you can find it in virtually any pharmacy, naturally. This is the version of DPH that we see a lot of times, but of course, when you prescribe DPH, a lot of times they'll also give you in the pill form. They may not necessarily give it to you in the syrup form. And of course, there's also Unisum. Generally speaking, these options can be useful, but are not ideal for long-term improvement in sleep. Especially with DPH, we know that a lot of persons develop tolerance with it over time. So it can be useful in the short term, but we don't necessarily consider them long-term options. And because I think Dr. Walcott did a very good job going over some of the pharmaceutical options available, prescription pharmaceutical options, that is, I decided not to really focus on that area of this presentation. But let's look at other things that affect sleep, and things that we can all modify and change. How does technology affect sleep? We know factors that hinder sleep include blue light emission, from our smartphones. There are apps and settings available in our phone to reduce the blue light emission. And generally, guidelines are now widely recommending coming off smartphone devices or devices that we know will radiate high levels of blue light a few hours before going to bed. Digital procrastination is widespread and is another way that technology hinders sleep, and also cognitive stimulation. So digital procrastination really is just because you might be in bed, but you're delaying actually trying to actively fall asleep because you're still doing things. You might be working, or you might be finishing up some task. And with cognitive stimulation, of course, with video and audio, this can also make it so that pre-sleep arousal we had talked about earlier, that's improved with the mindfulness-based practices, might actually be increased when you have more pre-sleep arousal, which makes it harder to fall asleep. But it's not all doom and gloom. Wearable items and apps can help promote sleep. I think Dr. Morgan did a very good job of outlining the science behind it, show that they're not necessarily always the most precise tools, but they can sometimes provide information and highlight patterns. So not the most precise tools, and certainly not a replacement for some of the more sophisticated options available to us that you can get if you see a sleep specialist or a physician, but nevertheless can be a good entry point for persons that want to understand their sleep a little better. How do lifestyle factors affect sleep? Well, the irregular sleep schedule, we know that one for sure, and shift work. And I think, for an audience like this with a lot of medical professionals, we can all relate to how these impact sleep. Substance misuse is also a very big one. We know that caffeine affects sleep. I think a lot of persons appreciate that, but also alcohol and nicotine. And always remember that caffeine is not only in coffee. We have very high rates of caffeine in a lot of our carbonated drinks. So when somebody goes out and has rum and Pepsi, they're doing a double whammy because they're having both alcohol and high levels of caffeine and sugar, which of course can lead to a disruption in sleep. We see it all the time in Jamaica, persons working and drinking these high energy drinks like Power, for instance, was the name of one of them, and boom. And aside from all the other health concerns that sometimes can be associated with excessive use of these things, it can also lead to the disruption of our typical sleep cycle, of a healthy sleep cycle. What about the environmental factors that affect sleep? Well, temperature regulation is important. We know generally we sleep better in environments where the temperature isn't too extreme. And we know that I think especially in our local setting, we can appreciate that. Noise, a very underrated factor that affects sleep. We live in a society where increasingly our residential areas are adjacent to major corporate or industrial complexes. And of course, we all know about the parties and concerts and stage shows and dances that keep near in communities. I think we as a society need to think a little deeper on how this might be affecting our sleep, our collective sleep issues. Because I can tell you that a very large percentage of patients that I see regularly have sleep issues. It's rarely at the forefront of why they come to visit me. And I think a lot of the doctors here will say the same. But once you start probing or asking, you will realize that easily more than half, maybe even more, of the patients you see will report not having adequate sleep. I know as a psychiatrist, that might speak to my patient population, but even my experiences, when I was training as an intern or SHO in primary healthcare, kind of revealed that to me as well. So I think, we as a society have to think about how we can engineer environments and housing situations that can allow us to both benefit as a society from that industry, because the entertainment and recreational industry is important for our economy. I myself am someone that goes out a lot, so I appreciate it. But at the same time, how can we make it so that it doesn't affect or spill over into issues with sleep, persons who are trying to get it in their homes? So what are some simple recommendations that we see across guidelines? So you want to avoid electronic devices and try and use them 1 or 2 hours before bed. So try and put it aside. If you decide that you're going to sleep at 9, try and put down the device at 8 or 7. And I've consistently seen and heard persons report that they sleep better when they do this. You want to establish a consistent and calming bedtime routine. That's a big one. And you want to keep the room dark, quiet, and cool. So again, looking at all those environmental issues and what we can and can't control. I don't know what you guys think about the idea of subsidizing fans or ACs as a kind of public health intervention that we should consider. It's not just because it helps promote better sleep, it actually helps promote better well-being at large. So maybe that's something we can lobby for, start talking about more in the public arena. What's sleep hygiene? There's a lot of stuff on sleep hygiene. And frankly, a lot of what we've discussed so far today underscores sleep hygiene. So I decided that rather than use a textual slide for this, I just found a very interesting graphic. Credit goes to the Central Health Center. That's a website. I can send you the link for it. This is their graphic. It's not mine. I didn't make it. But again, it focuses on routine, importance of exercise, and a lot of the things that we've discussed already are covered here. Sleep hygiene has been shown time and time again to be very effective in promoting good sleep. And so generally what the guidelines are, like the NICE guidelines, the National Institute for Clinical Excellence in the UK, is to suggest that we promote sleep hygiene when we first come across our patients that may have sleep issues, before even looking onto things like supplements or OTCs or prescription pharmaceutical options. So let's try and make sure that we are as familiar with sleep hygiene as we can be. And I think we've done a good job so far today in outlining in different ways throughout the presentation what good sleep hygiene entails. So let's leave today's seminar with that one, that sleep hygiene should actually be our first line treatment for sleep issues. I think as both healthcare practitioners and again our patients, sometimes we can be a little impatient. We want the quick fix, and patients will get vexed with you if you don't prescribe them the medication that'll help them with their sleep now. And there is a room for that because, of course, I'm sorry, because of course, if the impact of poor sleep is having particularly harmful effects, then there might be a need to act quickly. But I do think many times we can also try and be more patient as healthcare providers, and also try and promote patience amongst our patients. Well, sorry, but yeah, promote greater patience amongst the persons we serve by looking at sleep hygiene. I know it's not necessarily as enticing as maybe just getting a quick fix, but it's shown to be very effective in the long term, very cost effective again. And I just want to emphasize the importance of the comfortable bed. That's the only one thing I'm going to highlight from this graphic. I think that's an underrated element of good sleep hygiene. I've found many persons are not sleeping in adequate beds and then are surprised when they have sleep issues. So I think, the adequacy of the bed, the adequacy of the pillows, those are some things that we also need to look at when trying to explore why someone isn't sleeping well. How cultural practices affect sleep? Well, Japan often ranks lowest on average sleep duration when they do these kind of surveys. And as some of you may know, Japan has a very extreme culture when it comes to the importance of formal work and working for long hours and things like that. But I also want us to think about how the culture, our subcultural practices affect sleep. Again, especially as medical providers, within our own culture, it's kind of believed that being able to stay up and work long hours is kind of a mark of strength. And if you can't manage to sleep, manage to work on limited sleep, then it's a sign of being lazy. This is something that has increasingly been fought against, especially in the UK. We see where they've made changes to how doctors on-call duties are arranged. And, of course, I'm going to use this opportunity to big up the JMDA, who I know have also been trying to see if we can start expanding the dialogue when it comes to how us as doctors view sleep and relaxation and rest, and especially how our employers and persons in senior management in medical establishments and administrators also look on it. So again, something for us to think about. What cultural changes can we try to affect that might lead to greater sleep? Some cultures view sleep as essential for health, others see it as a waste of time. Let's try our best to be the type of culture that views sleep as essential. And I think as healthcare providers, we have a very important role in promoting that. And it's not just medical practitioners. The work culture in Jamaica in general seems to really valorize the idea of getting limited sleep and just try to maximize output at the expense of your health. And because of this, leaders are so important. And when I talk about leaders, I mean managers, so leaders in the workspace, managers and employers. Because not only do the hours that we work in our workspace affect how we sleep, but also bear in mind that when we have managers or supervisors that don't respect our work boundaries, our work-life boundaries, then that also affects our sleep, right? If you have work supervisors or managers who believe because they're up at 11 p.m. finishing a project, that you need to be up at 11 p.m. and accessible to them to take a call, then that's not necessarily the kind of work environment that's going to lead to your employees and staff being able to get adequate sleep. And again, the studies are clear that when staff and employees get adequate sleep, you get better outcomes. Parents also play a huge role. Dr. Walcott did a good job emphasizing that. Parents really play an important role because we want to set habits from as early as possible. Yes, getting good grades matter, but I think both parents and educators can play a very central role in trying to highlight the importance of getting adequate sleep for your health. Really, we're going towards one of the last sections of the presentation. We're almost finished, guys. I want to talk about integrated and multidisciplinary care when it comes to optimizing sleep. My first point is that primary care physicians play a critical role. As I said, I would love for us to do a survey amongst primary care physicians. I think we'd find that a large proportion of their patients report inadequate sleep, right? Especially amongst persons in midlife and our older adults. And I really like what one of Dr. Walcott's messages, which is we shouldn't accept this as the norm. We should see it as something that actually we can help our patients with. The presenting complaint from most of our patients is rarely inadequate sleep. But I think that primary care physicians and as doctors in general, we need to have good clinical suspicion. And even if, you know, focusing on sleep may not be the most urgent or immediate need, ensure that we still factor it into our treatment plan at some point. Especially, again, this is why I say primary care physicians are so important, because you're the ones, you know, especially our family physicians who they see time and time again, and our pediatricians who they're going to be seeing time and time again over the years. So let us make sure that we highlight, we're both suspicious about their sleep patterns, try to understand what's happening, and make sure that we have a holistic approach to investigating sleep issues. And by holistic, I mean the exact same things we've been talking about today, looking at how technology might affect their sleep, how cultural practices, and by this I even mean subcultural practices, beliefs in their home, beliefs at work, how environmental factors might be affecting their sleep, right? And then as Dr. Walcott would have adequately mentioned, even looking at how psychiatric or medical concerns might be affecting their sleep. I think if primary care physicians can take on this approach, and not to say that we don't have primary care physicians that are already doing this. There are many great primary care physicians that are doing this already. But just to emphasize that, I think when primary care physicians can take on that type of holistic approach to investigating sleep issues, that will have even better sleep amongst Jamaicans. I think sleep specialists are underutilized, you know, and I'm happy to be able to say this following that excellent presentation from Dr. Morgan. We do have sleep specialists in Jamaica. I feel like not all doctors or patients know this, but we do have very competent and passionate sleep specialists in Jamaica, right? And I think as we need to utilize them more. I'm very thankful to Dr. Tolo Reed, who works at Andrews Memorial Hospital. I've referred him quite a few patients to him over the years, and I've seen notable improvement in my patients' outcomes. You know, when you look at a condition like obstructive sleep apnea, for instance, and you know, the reality is many times primary care physicians or me, as a non-sleep specialist, we might be the first ones to pick it up. They'll present our persons who've come to me with symptoms of depression and anxiety. And when I started to probe a little deeper, it appeared as though they may in fact have some kind of underlying sleep issue, like a sleep disorder. And when I've referred them to the sleep specialist, I've managed to see significant improvements in their mental health without even the need for psychotropic medication. So I really do think sleep specialists are underutilized in Jamaica. So another big message I wanted us to carry home from this presentation is where we see the need, again, our primary care physicians play such an important role in identifying and being able to adequately explore and treat sleep issues. But where we see that this might be a little bit more advanced, we need to utilize our sleep specialists more. And I think one of the things we can do actually, you know, organizers of this seminar, is when we send out, you know, the emails, thanking persons for coming, I think we can also send them maybe a list of the sleep specialists in Jamaica. That's just a suggestion. I spoke to my personal experience with one. He's not the only one. There are others out there. I don't think I could use this presentation to highlight all of them, but I think maybe that's a good idea, a very practical thing we can do as a community so that we're all aware. Yeah, this is just to say they're underutilized in general and underutilized in Jamaica specifically. I like to keep my slides simple, guys. So my personal story on sleep. So you know we're coming to the end because now I'm giving you a personal story. It's a simple one. The truth of the matter is I had a very complicated relationship with sleep over the years. You know, when I was in high school, I went to Campion. I wasn't always getting a lot of sleep, whereas I was an athlete there as well. And always have emphasized wanting to have a very active social life. I still do. So I wasn't getting that much sleep in high school, and this is not uncommon. We know that for many persons, high school is when the sleeping issues start. Then I go into med school, And I'll never forget when I was in first year, one of the lecturers scolding us, saying that, yeah, you need to be able to operate unlimited sleep to get through med school, right? So that's the messaging. Finish med school, become a doctor, and then I got into the residency program. And this is really the heart of my personal story on sleep. In my first year in the psychiatric program, I remember as I was getting ready and studying for my exams, I wasn't getting that much sleep. The night before the exam, I got very few hours, which is typical. That's normal for me. I went through high school and mid school with that. And I did manage to pass my exams and actually pass them well, thankfully. But I wanted to try something different for DM2 because I felt like sleep is one of the topics we learn about in the psychiatric curriculum. And like I said, the evidence is very clear that students that get more sleep get better grades. Even medical students, by the way, the studies show. So I said, all right, let me try something different this time around. Now, I decided to be very structured in my approach to studying for DM2. I started months in advance, which actually did allow me to get adequate sleep for the weeks leading into the exam. And on the night before the exam, let's be real, guys. For all of us who've gone through med school or DM or even CXC or CAPE, we know that the night before the exam, there's always a bunch of topics that we feel like we have to review, right? Even if we review them like 3-4 times. I put a hard stop. I said, when this hour comes, I'm not going to lie and say I remember the hour. I think it was like 10 o'clock. I said, when this hour comes, I'm going to stop studying the night before the exam, even if I feel like I have 3-4 more topics I need to do. And that's exactly what I did. It took a little bravery, but I said, you know what, let me try and follow the science. And I'm not trying to brag, but I did actually manage to get the highest score in 2 out of the 3 components of my psychiatric assessment for the DM2, the actual highest grades in the Caribbean, in the region. I'm not going to say all of that goes down to getting better sleep, but I know that sometimes when you hear presentations and discussions like this, it doesn't seem practical. We all have so much work to do. It seems very impractical to just say, prioritize sleep and get more. But I'm just trying to give you at least my own personal account of when I tried it and it did work. Am I always maintaining positive sleep practices now? Sometimes yes, sometimes no. I do fall off sometimes, definitely. But over the course of a lifetime, especially again when we're trying to all promote healthy aging, it's not about getting it right every time. It's about trying to do the right thing as best you can, and even when you fall off, being ready to come again. So, as someone as Dr. Brown Morgan quite rightly put it in the introduction, what we have to focus on is understand awareness first. Sorry, that's what I wanted to say. Awareness first. Having awareness of good sleep practices, what they are like, what they entail. And once we have that awareness, we can always go back to it even when we fall off, because things will happen. You're going to have your first, second, or third child. You're going to go to the party tomorrow. I think you are going to have sleep disruptions, but you can always go back to the good practices. And I think that's why this seminar is so important. So what are my take-home messages? 1, sleep is important. I want to emphasize, I think we all appreciate that sleep is important on an individual level. I think we've done a very good job emphasizing the ways in which poor sleep has a very significant impact on us on an individual level. But I also want to say that I think promoting sleep is a public health initiative. I think if we get better sleep, we get a better Jamaica, because I do believe that a lot of the issues with emotional regulation, concentration, and things like that plague us sometimes as Jamaicans could be improved significantly with just a little bit more sleep. Supplements are useful, so let's try and use them in our practices. Sleep hygiene works, guys, believe it or not. So where it's appropriate, let's utilize it as the first line in treating persons who have sleep problems. Technology, environment, and culture impact sleep. So when we're taking our histories, we're investigating sleep issues, we have to think about these things as well. What is the role of technology? I have found it very useful to ask about smartphone or smart device uses, and have found that just that simple change can sometimes show significant improvements in person's sleep and mental health, by the way. So let's not forget the importance of these factors when we're trying to explore why someone might be having sleep issues. Primary care physicians play a key role when it comes to improving sleep in Jamaica, and referrals to specialists should be utilized. I wanted to emphasize the need for us to refer to our sleep specialists, but also psychiatrists, pulmonologists, ENT surgeons, psychologists. There is sometimes, as I said, primary care physicians can do a lot on their own. And I think that if our primary care physicians feel confident in being able to assess and treat sleep, that alone would have a huge public health impact. But I also think that our specialists are being underutilized, especially our sleep specialists. So let's just try and make sure we have that in our consciousness and awareness. Thank you very much, guys.
Thank you, Dr. Kazaara. And we thank you very, very much for that promotion for our GPs, for them to realize the role they actually do have to play in recognizing the whole idea of the sleep disorder in their patients, and that, as you know, that in a great percentage of patients who have sleep disorder, they're having so many other disorders as well, depression, the chronic diseases, and the fact that it's a bidirectional matter, as you pointed out. You know, the chronic diseases and will lead to poor sleep, but poor sleep in turn leads to the chronic diseases, and this has been emphasized by other speakers here this evening. So, you know, higher quality of sleep. We need to deal with the causes of poor sleep, and we need to also know that when we control these conditions, Jamaicans live longer and better. So that's according to your wording. We want to just open the floor right now to questions. I'm going to start with one question, which is the natural supplements that you spoke of. Do they actually affect REM sleep? Because we've been saying how important REM sleep is in order to maintain our youthful brains and our cognizant selves, and to actually remember. So,
Sure, no problem, Dr. Brown Morgan. So the reality is, I'm going to just speak broadly, because I don't know if we can go into the minutiae of each of them, but broadly speaking, no, they don't actually improve REM sleep. And I think that's such a good point to have in this discussion, because as Dr. Walcott would have mentioned in his presentation, that might underscore why we see such unreliable or inconsistent, result findings when it comes to the impact that these supplements have in improving our patient's sleep. I think that might be at the root of it in a lot of ways. So in short, no, right? I'm going to emphasize that I think, sleep hygiene and supplements can be an excellent starting point and will help a large percentage of our patients that have sleep issues, but they're not magic. None of them are like a magic solution or anything like that. But great question. Thanks.
So they're the beginning, a way to start to become aware of the problem and to get going on the solutions. I see here a question in the chat. Someone says, I'm a natural sleeper, but lately I go to bed at 7 p.m. and awake by 1 a.m. to use the bathroom. Sometimes it is hard to fall back asleep, and I'm up until 4 a.m. and it's time to go to work. Can you address that question at all? This being awake until 1 would let us think that this person is an anxious person, according to the outline given by Dr. Walcott. Stay awake and can't fall back asleep. How would you help this person up till 4 a.m.?
Okay, thank you. So Sorry if it seems like I'm kind of piggybacking on Dr. Walcott and Dr. Morgan a lot of times in answering these questions. I just think they did such a good job underscoring some key things when it comes to sleep and how to manage it appropriately. Dr. Walcott, I think, made a very good point that diabetes, for instance, right, one of the most common conditions that we find in midlife, can sometimes lead to these kind of disruptions in sleep. So let's first explore if there are any, I don't know the specific medical details of the person asking the question. But what I would say is if someone were to come to see me, we would want to make sure we explore if there are any medical conditions that could be optimally managed, for sure. Definitely there's that possibility of psychiatric issues and anxiety. The good thing is that we talked about mindfulness-based practices already, meditation, yoga, body awareness, things like that. These are real things. And the reality is maybe less yoga, but certainly meditation, body awareness, and just general mindfulness are actually things that can be self-taught very effectively. I really like to utilize those things when looking at things like anxiety and depression. Obviously, we need medication sometimes, but in many cases, in an instance where someone might wake up in the middle of the night and not be able to go back, it might be due to intrusive thoughts. It may be due to some psychosocial stressors that haven't been addressed. And so if they can start practicing some of those mindfulness techniques, it might actually allow them to be better able to handle whatever anxiety or thoughts might be going through their mind. And again, I'm going to emphasize the importance of them looking at technology and environmental factors. Because some people wake up in the middle of the night and then go right straight to their phone, right? Wouldn't advise it, guys. Or people stay up and they keep the lights on in the middle of the night. So little things like that. Try your best not to eat when you wake up in the night. Little things like that. So I'm sorry that I can't answer like directly everything, but these are some of the things I would look at just to answer the person's question. And I guess what I would advise, yes, I would advise them to go and see a doctor. Exactly. I would advise them to see a primary care physician. Precisely, Dr. Brown Morgan. There's one thing I will say though, that I have found again, and I always emphasize that, but I have learned when it comes to using supplements for sleep, is that there's a lot of variability across patient populations. I'm always cautious saying that one thing works, but I want to say, Dr. Brown Morgan, I have found, and I did a little reading on it, zinc is actually a really good supplement for persons that have interrupted sleep. I have found that it actually leads to less sleep interruption. And I did do a little digging and reading, and I found some studies that back that. So maybe that's also something the person could look at, but no promises, guys.
Okay. So to put two in one, because we're trying to do something with our time management here. Do you have to take drug holidays for melatonin? And can one become dependent on these sleep enhancing drugs? So,
okay.
So it's a mixture of the natural with the actual medications.
No problem. So let me answer the very easy one first. The majority of agents that I would have highlighted in my presentation are not associated with dependency, fortunately. People don't really generally get dependent on things like zinc or magnesium. So that's the good thing. Now, in Dr. Walcott's presentation, there was a mention of some benzodiazepines, which can be very useful when it comes to helping with sleep. I think a lot of us as practitioners know that, but we also know that they carry a very significant risk of dependency. And so a lot of times we like to use them in the short term, but generally we don't try to use them past 3 to 4 weeks for that reason. I think that would be my general view on it. So the majority of herbal options, non-prescription options are not likely to cause dependency. And amongst our medication for sleep, the majority aren't regarded as being long-term options, by the way. They ideally shouldn't be used as long-term options. But in particular, benzodiazepines have been shown to carry high risks for dependency. So we always need to be mindful. It can be very useful if we use them between 1 to 3 weeks, but beyond that, we have to be very careful. And I think what I want to also use this opportunity to say is sometimes these agents can be used to provide immediate relief. That is important, while we also institute the sleep hygiene and things like the mindfulness-based practices, that when they come off them, they can have a very solid foundation for getting better sleep. If it is that we have to, as I said, there'll be cases where we have to do them first, we'll have to use them first. In cases like that, let's just make sure that we pair it with things like the sleep hygiene and everything else that we discussed. And I think there was another question. Wait, yeah, it was a 2-in-1. I'm sorry, did I miss the other one?
No, I
Sorry,
think I think you kind of covered the two. Sam, can you just check that back for me, and also check if there were any others, and we then move on. Sam?
That's it, Doc. And I think we've also done the time for the Q.
Yes.
Hi, Doc. Yeah.
The 2-in-1 question, which oh Lord, I mean, okay, there's this thing here to what? Ashwagandha, the use of ashwagandha, ASHWAN.
Right.
Yes, what's that?
Okay, so that's also a natural remedy associated with a number of benefits for persons. Some people come because they say it actually helps their anxiety, for instance, and persons have reported that it's useful for their sleep. So when it comes to that particular supplement, let me say this: there is growing evidence to back it as a useful option in treating things like mild to moderate anxiety, and it has been shown to help with sleep to some extent. I don't have that much experience with it personally. So the best way I can answer that question is just to say that there is a growing body of evidence that suggests that it could be a useful item to include, but I also will say that there's no guideline now that recommends it as like a first or even second line yet. It may be that the science just needs to catch up with what's going on the reality, because I do see patients bring it. But as a healthcare provider, I think that's the best way I can toe the line between saying that there's growing evidence that shows it helps, and I have seen some persons who have used it themselves to good effect, but that it's not necessarily recommended by any guidelines yet, because we still need a greater body of evidence before I guess we can back it as a community.
All right, so I'm going to say thank you very much here. There are some other questions, but which you can answer in the chat if you can spare the time while we move on here, because we've got to move on, I think, at this time. And so we'd like to thank you, Dr. Kazaara, for excellent right in the face with us, Jamaican type presentation, and back and forth, just what we needed as well to keep us going at this time of the afternoon. So thank you so much. All right.
You're welcome.
Yes, and right now we are going to move on, and we are going to we're doing the post test right now. I think people should check in the chat and get going on the post test. But we are also moving on to our summary, and this will be done by Dr. William Brown, our president of the JMHS. So, Dr. Brown, over to you at this time.
Thank you very much, Anna. So far, so good. This will be my shortest summary because the theme is clear. Starting with Dr. Walcott, he explained the biology of sleep. Then Dr. Morgan came up and explained.
William, not hearing you.
You're not hearing me? You can hear
William,
me
not hearing you.
You not hear me? Okay, I don't know.
William.
You can hear me a little better now?
Yes, a little better now.
A little better now?
Yes, yes. Go ahead.
Oh, right. So Dr. Morgan did a good job. Now understand what is sleep apnea and the pros and cons of it, also voluntary and involuntary, normal breathing, and the factors that can help to detect signs and symptoms of sleep apnea. In fact, the risk factors, she mentioned risk factors like weight gain, obesity. lifestyle. That was quite interesting. I learned quite a lot from the sleep apnea and what it means to in relationship with to diseases, hypertension, diabetes, etc. And Dr. Brian Kazaara did a very good job. And just to summarize what he says in 2 lines, that sleep is important, supplements are useful, sleep hygiene is important, and it works. All right. And that technology and our environment and culture all have input into our sleep patterns. And the primary care physician is very crucial in its role in detecting those who have sleep problems and to refer them to specialists. So this is a summary in the interest of time. Anna, over to you. Thank you.
Thank you so very much, William, for being concise, precise, and sweet. Getting together what our speakers have presented in a nutshell. And it seems to be my time also to be succinct in bringing you the closing remarks. And well, I'd just like to say good evening to everyone who is here still, and we still have 391 persons here with us. And just to say it's good to be here still in these final moments of this very, very successful sleep conference. I thought I could use these few moments to once again stress the bidirectional relationship between stress and sleep, and to emphasize the now clear fact that sleep disturbances often perpetuate psychiatric and physical illness, including many chronic diseases, and this making early identification and management of sleep disorders a priority for long-term health outcomes. So let this moment be a call to action, a move towards practical applications, integrating targeted therapies with mindfulness into clinical practice. Sleep health is definitely not just a function of respiration, but a combination of several faculties. I hope that all the participants here today will be forward-looking and continue advocacy in this new knowledge gained here today as we aim for a future where sleep health is a critical public health priority. You know, it's something we take for granted in other parts of the world. But here in Jamaica, nobody sees the actual sleep that we're getting, or few people see the actual sleep we're getting as really affecting how we perform, how well we do, how well our children do, as brought out by all the doctors here this evening who presented. And let us who in our communities, the lay people online, please realize in their families where they have their children looking after, where they see their brothers and sisters trying to work in the community, even those people who seem to be having problems, motor vehicle accidents, whatever, be an advocate. Speak to them about sleep or possible lack of sleep in that they're obtaining, because see, it's playing a huge part in the life and wealth of our community. And so at this point in time now, it is just time for the closing prayer, which we will listen to. I don't know which person from our exec is going to give it. But I don't know if this is going to be Magdalena again. Who is that? There is no one in particular listed here to give the closing prayer. But it would normally be
Dr. Mattis. Is Dr. Mattis supposed to say final prayer?
Yes, he was not here earlier, so I'm not sure if he's here now.
All right, so Magdalena then, thank you.
Okay,
Oh,
let us pray. Yes, let us pray.
Oh, sorry.
Sorry, is Dr. Mattis here?
I'm scheduled to give the vote of thanks at the end. Do you want me to go ahead and give the vote of thanks, or you're...
Yes, please. Who is it? Yes, please, if you're scheduled. I don't have anyone on my report. My apologies. Go ahead.
Okay, well, it leaves me to really, really give the big thank you. This webinar was excellent in all respects, and I actually thank the executive committee for deciding on this topic for our first webinar this year. I'd also like to thank the Minister of Health for his greetings and opening remarks, which set the tone, giving us some statistics that we heard in this presentation. Thanks to all the speakers for their excellent presentations. We keep saying excellent, but it really, really was excellent. Our technical support, we cannot leave out Oldgate Solutions, and our sponsors, Indus Life Sciences, Abbott Nutritionals, Servicare Distributors, Apex Radiology, Medimpex Jamaica Limited, and the Jamaican Observer. We thank everyone, and to all the participants for attending, and we look forward to your presence at our next webinar. Thank you all so very much.
Thank you, Dr. Mattis, very, very much for that, for the vote of thanks. We were wanting to have a closing prayer just before you spoke. So we will now ask Magdalena Pupa-de-Nuez to close us with a word of prayer.
Let us pray. Father in heaven, thank you so much for the presenters and the information shared, and that we as a community can share with others and therefore help us all to be better citizens. And with that in mind, the Lord bless you, every one of you and your families. The Lord keep you and make his face shine upon you and give you peace during this coming week and a good night's rest. In Jesus' name, amen.
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 Amen. And good evening and good night.
Good
Everyone,
evening.
hope you enjoyed it. Dr. Mattis, I'm so sorry for this slight mix-up, but we were really, yes, well, we're good. All's well that ends well. In the good
Amen.
company. Yes, all right. Sam, thank you too. And we thank Marcy, our dear secretary.
Yes, yes,
all
yes.
that she does at all times. Thank you.
Yes. 3 cheers for Morsi.
Cheers, everyone. Have a wonderful evening. Thank you so much for joining. See you at the next one.
Thank you, Sam.
Sure.